Yeah. I think we are live now. Yeah. Hello. Good morning, all of you. Good morning, students. Welcome to our class today. And just like yesterday, we'll keep it a very interactive session and a very interesting session. Yes. So is the audio video all clear? Can all of you tell me if the audio and the video and everything is perfectly clear? Then we can start the session. Okay. And we will just, good morning, all of you. So welcome to the part 2 of our class. Today we've got 2 sessions, morning, evening. Yes, is the audio video? Yes, thank you very much. So we'll just a quick recap and a precap. Yes, so can all of you see my PowerPoint presentation screen, and are all of you able to hear me very loud and clear? And also just confirm with me what I'm writing, you all are able to see. Yes, can you tell me what I have written is visible to all of you? I have written it, what you are able to see, what I have written on the board. And is the audio and the video all clear? Okay. Very okay. So good to go. Ready? Okay. So just a quick recap and a precap. As usual, every day we start our session with the what we have discussed in the previous day and all that. So just to give you a precap, many of you were there yesterday. If anybody has missed out, do check out the yesterday's very important video. Yesterday we started off with the basis of the HPO axis. Very important topic. Then we went on to discuss about the different aspects of infertility in terms of what is the definition and what are the causes of various infertility. We're discussing that. Then we discussed about PCOS, we discussed about endometriosis, clap if you remember all this, and then we discussed very important the hysterolaparoscopy. We played a game. Yes, thumbs up if you recollect all these points. And then we discussed about the uterine factors, and we also discussed about the test for tubal patency test, yes or no. And then we had started off our discussion with the male factor analysis, and we had started only the male factor. We are now going to discuss about the various treatment. Okay, and I'll just show you. So we had just shown you this slide about the different causes, pre-testicular, testicular, post-testicular. We have discussed all this in detail, and a very important slide that FSH will tell me where is the problem. Okay, FSH will tell me whether if it's a very high FSH, that means the master is shouting very high. Why should the master be high? Because there is a servant problem. Okay, very low FSH, matlab master himself is sleeping, and normal FSH is a post-testicular. Yes or no? So we had finished off our discussion at this point yesterday. Rules remain the same. Ask question, answer question, right, wrong does not matter. Let us make it like a interesting rocking session. And I want all of you, those who are live, to constantly this, and please use only Telegram, because I will not be able to see the chat box provided to you. So all communication with me during the session will have to be through Telegram only. Okay, so I am sure all of you have joined, and all of you please answer the questions in the chat box, and let us begin our today's session. The agenda will be that we'll be starting with a very important topic of this IUI, IVF, ICSI. Then we'll go on to discuss. So today, what all we are going to discuss in this session, we are going to discuss about the IUI and the ART. What is all this? I'll explain to you. I'll also explain to you what is OHSS important image-based question. And then I will be going on to the very important topic of amenorrhea and contraception. Okay, and then of course afternoon also we'll discuss whatever fibroid prolapse. So it's going to be a very important day overall, where we cover a lot of important topics. Okay, now the most important treatment for the male factor is something called as IUI. Now anybody, IUI is what full form? Intrauterine insemination. Okay, intrauterine insemination. Now, can anybody tell me, is IUI and IVF same? If I write IUI and IVF same, true or false? In the chat box, anybody, IUI, IVF same or different? Just for me to understand. If I say IUI, IVF are same, this statement is true or false? Yes, all of you, those who are there. No, very good. Different. Yes, very good. Excellent. So basic, what is the difference? I will tell you. Excellent, all of you. Excellent. So all of you have the basic idea. Yes, very good. Okay. So now please understand, completely different. Yes, they are different. Now, first of all, understand what is IVF. We'll discuss in a minute, and then you'll come to know the difference. So what is done in IUI? Please pay attention. So all of you know this: uterus, cervix, fallopian tube, and the vagina. Okay, now the ovulation will happen from here, the egg will be coming over here, and the female has ovulated. Now normally the male partner will deposit the sperm in the vagina. Uske baad Olympic ka race shuru hota hai, and all the sperms try to go above, but only one of them gets the gold medal, which is to fertilize the egg. Okay, now obviously if the sperm count and the motility is low, then the sperm cannot reach to the top. So the treatment is IUI. Now, point number one, what you need to keep in mind for IUI is that IUI will only be helpful when the sperm count of the male is between 5 to 15 million per ml. Please keep this in mind. That means because I told you more than 15 million, more than 16 million is normal. Yes. So IUI will only work in this range. When the sperm patient is having oligospermia, motility is slightly less, asthenospermia, but the count criteria is 5 to 15 million per ml. So if in the exam they tell you that the male patient count is 1 million, 2 million, please don't mark IUI. Is it clear? So what is the treatment? पिक्चर अभी बाकी है मेरे दोस्त, बताएंगे आपको. Okay, so point number one to be kept in mind is कि IUI will only work in this sperm count range 5 to 15 million per ml. Now anybody, what is done in IUI is that the semen sample of the male is taken in the laboratory. We wash it, we prepare it, all the kachra I remove, all the lula langda sperms I remove, all the dead sperms are removed, all the faltu sperms are removed, and I bypass the cervix. Only the highly motile best quality sperms are taken. We bypass the cervix and push the sperm inside the uterus. That is intrauterine insemination. So it is like your World Cup cricket. It's something like I tell my students, like World Cup cricket team selection. Okay, we have got hundreds of players in India. Usme se all the non-competent player, faltu player you remove, and the best 15 you select and send them for World Cup. Check the India. Okay, get us the World Cup, like that. Okay, is it clear to all of you? So same thing, all the dead sperms are removed, all the non-motile, immotile sperms are removed, the sperms are washed, they are charged, and the semen is injected inside the uterus. Is this understood to all of you? That is IUI. But now is the most important point, all of you pay attention. From here, the sperms have to go above on their own, and even the egg has to come from here. So for IUI to be successful, my fallopian tubes, my means the patient fallopian tubes, have to be patent. Is this understood to all of you? If the fallopian tubes, common sense, all of you please look on the board. If the fallopian tube is blocked, suppose the tube is blocked over here, block over here, block over here, IUI cannot be done, IUI should not be done. Is this understood to all of you? The tubal patent, tubes have to be normal or tubes have to be patent, then only I can do IUI. So मुझे आप लोगों से, and of course many students ask me, sir, when to do IUI? At the time of ovulation. Obviously, if the ovulation is, if the ovulation is if the IUI is if the ovulation is today, then IUI I can't do 5 days before. I can't do IUI after 5 days. Okay. So generally the IUI is done at the time of ovulation. Student asks me, sir, when will I do IUI? So it's around ovulation. So if the ovulation is happening today morning, I can do IUI today, anytime in the day, or one day before, like that, because egg will survive for 24 hours. Is this clear to all of you? So मुझे आप लोगों से इतना ही expectation है कि whenever you mark IUI in the exam, just keep these two criterias in mind. What are the two criterias? Sir, fallopian tube should be normal or patent. And what should be the sperm criteria? What should be the sperm criteria for the IUI? What should be the sperm range? 5 to 15 million per ml. Is this understood to all of you? Can I get thumbs up? Okay. So if in the exam they tell you that suppose the patient fallopian tubes are blocked, don't mark IUI. Suppose they tell you count is 1 million per ml. Okay. 1 million only is the count per ml. Then again, don't mark IUI. Okay. I hope this is absolutely clear. Now, can anybody tell me? So, very good. Now, can anybody tell me? Of course, I'll show you the slide in a minute. Can anybody tell me where else can I do IUI? Okay. तो एक तो ये हो गया. This I can do IUI. Where else? I'm giving you a clue. Where else can I do IUI? Any idea? Yes, where else do you think we can do IUI? Yes, male infertility, yes. Inside uterine cavity. No, where else? Matlab, where else? IUI is done inside the intrauterine cavity. What other indication? One is this male factor infertility. Okay, when male has a problem between 5 to 15 million per ml, we can do. Where else? Think. Yes, cervical factor. Can you see this? Because we are bypassing the cervix. So there's a condition called as sometimes anti-sperm antibody. Okay, anti-sperm antibody in the cervical mucus. So that cervical mucus is damaging the sperms. So we are bypassing the cervix and directly putting the semen inside the uterus. So cervical factor. What else you need to keep in mind is, remember students, penile deformity. Count is very good. Count of the male is 100 million. But at the time of, there is epispedias, hypospedias, or erectile dysfunction. Okay, erectile dysfunction matlab at the time of erection, at the time of sex, person is not getting erection. Okay, like performance anxiety. Okay, like what happens is, like, if you must be knowing that so much tension, anxiety. Like remember when you used to have 1990s, early 2000 cricket match jab bhi hota tha, even now it can happen many times with cricketers. Today it's like, today to Virat Kohli or today to Sachin Tendulkar has to hit a century, otherwise India will lose the match. Same day he will get out in zero. Okay, so that is called performance anxiety or tension. Okay, so when I say Sachin Tendulkar not on the bed, Sachin Tendulkar on the cricket field. Okay, yes, vaginismus. Okay, where the female contracts the thigh muscle, so the entry of the semen sample is not entry of the sperms is not possible. Very good, oligosperm. Okay, so all this extremely important. Please pay attention. Male factor infertility में use करेंगे, but please underline this This underline this count this line very much. If the sperm count, all of you please read this loudly wherever you are. If the sperm count is less than 5 million per ml, IUI is ineffective. Is this understood to all of you? Unexplained infertility. Again, when all causes are normal, all investigations are normal, we can try IUI to help the success. This I told you, anti-sperm antibody in cervical mucus. By the way, this is a virgin topic, never ever asked till now in the exam. Only for my love for the subject I am teaching you. The first 15-20 minutes of today's lecture, completely virgin topic. IUI, we are going to discuss IUI, IVF and ICSI. IUI, IVF and ICSI, all these are virgin MCQs. All those who know virgin MCQs, my terminology, brand new MCQs, not asked till now, will come in the future exams. Yes, oligospermia, yes, you are correct Sanjay Kumar, oligospermia में use करेंगे ना, oligo means less count, so we can use it in your 10 million is oligospermia, correct, okay, 10 million, but it should be oligospermia, how much you should know, okay. Uh, okay, so it should be in 5 feet. Okay, and this is what I told you, semen deposition problem. Okay, okay, the count is very good, count is 100 million, but if a patient has hypospadias, epispadias, penile deformity, erectile dysfunction and vaginismus, and can all of you uh, read the last two lines very loudly. Patent fallopian tube is a prerequisite. If the fallopian tubes are blocked, IUI should not be done. IUI cannot be done. Is this understood to all of you? Yes, can I get 5 thumbs up? So just remember basic, okay, when the sperm count and the motility is less, but the female tubes are normal, I can do IUI. Even if the other indications you don't remember, एक cervical factor याद रखना चाहिए because we are bypassing the cervix. Okay, so just keep this in mind and we are sorted. Okay, sir, IUI only possible if the fallopian tube is normal or the fallopian tube is patent and the sperm count is somewhere between 5 to 15 million per ml. Okay, so now can anybody tell me what will I do if it's a tubal factor? Suppose if the patient fallopian tubes are blocked. Suppose that both the fallopian tubes are blocked. So what can be done? Any idea? What can be done? Yes, very good. Suppose, sir, if both the tubes are blocked, we can try surgery. We can try surgery. It is called as tuboplasty. Okay. Okay, we can try surgery to open up the blocks. Okay, sir, sometimes it can happen, sometimes the tubes are blocked like this and there are adhesions, so I can break the adhesions and try to make the tube patent. Okay, and check with that methylene blue dye, okay, that the tube is patent or not. Okay, all this we have discussed yesterday, tubal patency test. Okay, so either I can do a surgery try, but if the surgery fails or sometimes the tube is so badly damaged that the surgery is not possible only, very good, then the only option is IVF, or in layman's language test tube baby, or in vitro fertilization. Okay, now details not expected for you to remember but very fascinating, so I will teach you. Okay, so lifelong remember only two options. Okay, sir, whenever there is tubal factor, we have got options of only two things. Either, sir, we can try a surgery, or the only option is IVF. Okay, IVF is in vitro fertilization. Now, what is done in IVF? Please pay attention. In IVF, step number 1, lot of injections are given to female to make her produce multiple eggs. Okay, I told you yesterday recombinant FSH or HMG. Can anybody tell me the full form of HMG in the chat box? HMG, human menopausal gonadotropin. Where do we get it? Where do we get HMG from? Where do we get HMG from? Yes, very good. Urine, clap, clap, clap. कल सिखाया, आज रिवीजन, जिंदगी भर याद रहेगा. That is how effective the teaching is lifelong. Yes, urine of the postmenopausal lady, absolutely correct. Yeah, urine of the postmenopausal lady is what you got HMG. So this is to help the ladies, help the female grow multiple eggs, because I don't want one egg. I want 5, 5, 6, 6 eggs in each ovary. Okay, so please pay attention what is done. Okay, what is done is that for details we are not supposed to remember. Just remember things that, sir, I want the female to produce multiple eggs in the ovary. Okay, 5, 5. So this is the one side ovary, of positron. Then this is the uterus. Okay, the uterus, vagina, and this is the other ovary. Okay, so ovary, I want 5, 5, 6, 6 follicles, 7, 7 follicles to grow in each of the ovary. Okay. बेटा बिलाल कल बताया ना बेटा, what should be the minimal number of sperm count? 4%. बेटा Bilal, yesterday lecture told to you. Okay, please see this again, revision. Yesterday I told you. Okay, only 4% sperm should be morphologically normal. Okay, is it clear? Yes. Okay, that's why more than 96% abnormal form is called as teratospermia. Yes, perfect. Okay, so now please pay attention, all of you. Come back over here. Okay. Yes. So now step number 1, we give injections to female. Now when the follicles are ready, on each side, okay, when the follicles are ready in each side, Bilal will come to that. Okay, we'll come to that ovarian reserve. Don't worry. But the answer is AMH. Okay, first is the answer, anti-Mullerian hormone. Okay. Yes. So when the follicles are ready, I will go through the sonography guidance. I puncture the ovaries, and I suck out all the eggs out. This is the first step in IVF. Ovum pickup, somebody said. And all the eggs, please slow. We am going slow only, beta. Okay, I'm going to repeat, don't worry. Okay, so all the eggs, because it's not important. What is important, I will go slow. What is not important, I might go fast. Okay, all the eggs are sucked out. Okay, so basically this is the most important difference between IUI and IVF, that all the eggs are going to come out of the body. In IUI, where was the egg, if you remember? Sir, in IUI, the egg was inside the body only. And that is why when I asked you first step, is IUI, IVF different, same or different? Different. Okay, sir, the difference is that, sir, in IUI, the egg is inside the body only. Matlab, egg is inside the female only. Okay, but in IVF, the eggs are sucked out, eggs are outside, eggs are coming out. This is the basic difference between IUI, IVF. Clap if you have learned something new. Okay, क्या suck out है? So simple है, basically nothing complicated. Multiple injections are given. Okay, Rahul Kumar, understanding? Injections are given to female. These injections are given, and then once the eggs and follicles are ready, I suck out the eggs. Okay, we suck out the eggs out. So in front of the petri dish, all the eggs which are there in front of me, whatever 5, 6, 7, 10, I can see under the microscope. Okay, under the microscope. Okay, now on top of each egg, I put roughly 50,000 sperms. Okay, so roughly 50,000, 1 lakh, 1.5 lakh, 2 lakh, 2.5 lakh, 3 lakhs. So now suppose even if the sperm count is say 2 to 3 lakhs, our job is done. Anybody, for IUI, what was the criteria? Sir, for IUI, the criteria was 5 to 15 million per ml. So, mathematics, 1 million, 10 lakhs. Correct? 1 million is 10 lakhs. Yes or no? 1 million, 10 lakhs. So now, if the count of the male is say 3 million, 2 million, 1 million, even half a million, our job is done. What can I do? I will do IVF. Okay, so IVF was initially invented for tubal factor, but I can also do for male factor. But what male factor? Sir, male factor like 1 million per ml sperm count. Okay, 1 million per ml or even half a million, 0.5 million. Okay, why half a million? Because half million matlab 5 lakhs. Okay, 0.5 million per ml. Is this understood to all of you? Okay, I repeat. Okay, sir, for basically male factor, just remember male factor where IUI is not possible. Okay, उतना भी याद रखेंगे तो चलेगा. Male factor है, but where IUI not possible. Why IUI not possible? Because sperm count is still very low. Is this understood to all of you? Then also I can do IVF. And again, we'll play a game towards the end where you will know what is that. Okay, that means, sir, suppose if I have a patient, is it clear, Rahul Kumar? Now you're understanding, please? Because please tell me yes or no. Okay. Okay, sir, suppose I have a male patient whose sperm count is, say, 3 million, 2 million. Then can I do IUI? No, because sir, IUI requires only 5 to 15. IUI requires compulsory 5, 7, 10 million. So if I have a patient who has a sperm count of, say, 1 million, half a million, then I can go for IVF. Is this understood to all of you? So IVF is done for tubal factor also. And also I can do it where the sperm count is very low. अभी सर इससे भी अगर स्पर्म काउंट कम है, 5 स्पर्म, 50 स्पर्म, तो क्या करेंगे? पिक्चर अभी बाकी है मेरे दोस्त, 5 मिनट के बाद बताऊंगा. ओके, अगर इससे भी स्पर्म काउंट कम है तो क्या करना है, विल टेल यू. अभी के लिए खाली याद रखो कि फॉर IVF समवेयर अराउंड 2, 3, 4, 5 lakhs मतलब 1 million. ओके, हाफ अ मिलियन टू 1 million तक काउंट अगर है, 1 million पर ml तक अगर काउंट है, 1 million पर ml या 0.5 to 1 million per ml तक अगर पेशेंट काउंट है, then we can do IVF. Now what is this egg and the sperm? Sir, egg and the sperm is the embryo. Now this embryo is kept in the incubator for 2-3 days. Okay, now obviously whole 9 months the baby can't grow in the incubator. बराबर, that will be the latest technology. Egg ले लो, sperm ले लो, incubator में डाल दो, after 9 months directly open the incubator, direct home delivery. Like Swiggy, Zomato, then no delivery required. Then I have to do only Aram. I don't have to do any delivery. I'll just be like this sitting. And directly after 9 months, madam, today is your baby's birthday. We are delivering the baby hot, fresh, ready. So 9 months के बाद 9 months के बाद इंक्यूबेटर खोलने का, बेबी को बॉक्स में डालने का, स्विगी जोमेटो गाय ऑन द स्कूटर, टिंग टोंग, हैप्पी बर्थडे बेबी, मदर फादर रेडी टू रिसीव द बेबी एट होम, डायरेक्टली होम डिलीवरी ऑफ द बेबी. ओके, देन नो डिलीवरी रिक्वायर्ड बाय अस. ओके, बट ऑब्वियसली दैट्स नॉट, देन एवरी 2-3 months, हेलो बेबी, हाउ आर यू, पूरा बेबी इंक्यूबेटर में ही ग्रो हो रहा है. ओके, दैट्स नॉट गोइंग टू happen. Okay, so basically what is done is, okay, after 2-3 days, obviously the embryos you will take, whatever 2-3, and through the cervix, you will push the embryos back inside the uterus. This step is called as embryo transfer, and generally 2 or 3 embryos are transferred into the cervix. That's why the whole through the cervix into the uterus. So the whole name of the procedure is IVF-ET. What is the meaning of IVF-ET? In vitro fertilization and embryo transfer. So please understand, whether you say IVF or you say IVF-ET, both mean the same thing. Because when you say IVF के बाद embryo transfer तो करना ही है. Embryo transfer is a part of it. Okay, now can anybody tell me, looking at the board, what could be the side effect of this IVF? Anybody? What could be the side effect of this? Looking at the board, chalo, answer is on the board. We have transferred 2-3 embryos. So क्या हो सकता है? Yes, twins or multiple pregnancy can happen. Okay, so example, remember Farah Khan, Bollywood dance director, Bollywood director Farah Khan. Yes, she has made movies like Om Shanti Om. Farah Khan is triplets. Okay, she always makes names with 3 movies with 3 names. Okay, Main Hoon Na, Om Shanti Om, Happy New Year, all this because she is having triplets. Okay, so Farah Khan is triplets because Farah Khan is IVF pregnancy courtesy Jaslock Hospital, Mumbai. Similarly, Manyata Dutt, okay, Sanjay Dutt's wife. latest wife, because he had 2-3 wives in the past. Manyata is also twins because Manyata is also IVF pregnancy. So this is only for your general knowledge and time pass. They will not ask you this in the exam. Celebrities who have done IVF are 1, 2, 3, 4, all of the above. Okay, there's a question नहीं आएगा, but just remember that whenever you transfer multiple embryos, yes, twins or multiple pregnancy can happen. And Bilal, yes, we're coming to OHSS in some time. Okay, now please understand one thing, just for your knowledge, that when I transfer 3 embryos, it is not that always there'll be triplets. So if I transfer 3 embryos, only 1 can get implanted, 2 can get rejected, she can get 1 baby. 2 can get implanted, she can get twins. All the 3 can get implanted, she can get triplets, and all 3 can get also rejected and IVF fail. Patient's naseeb, bad luck. IVF can also fail. IVF is not 100% guarantee. बात समझ में आ रहा है? तो सर, when we transfer 2-3 embryos inside the uterus, which embryos will stick, which will get rejected, that we don't know. Is this clear to all of you? तो in nutshell, ध्यान से सुनेंगे. Rahul, I'll also repeat for all of you. Just tell me if you understood 100% yes or no. Just type yes in the chat box after you hear me this out. Okay, sir, when the tubes are blocked, when the tubes are completely blocked, or the male count is very low, where IUI is not possible, the only option is IVF. IVF may first we give injections to female to make the eggs grow. Okay, so this is called as ovarian stimulation. Okay, we are stimulating the ovary. Okay, so ovarian stimulation is done. Okay, then what is this step of sucking the eggs out? Yes, this is called as ovum pickup. Ovum pickup or oocyte retrieval. Eggs are coming out of the body, oocyte retrieval. And third step is you mix the egg and the sperms. You mix the egg and the sperms and you create the embryo. So embryo is created in the IVF laboratory by mixing eggs plus sperms. Okay, and that embryo is kept in the incubator, and after 2-3 days, the embryos are transferred back into the uterus, which is called as the embryo transfer. But the success is not 4-5. Success of IVF generally 40-50%. Okay, so generally one IVF failed, then you can also try again. But if you try 2-3 times IVF, 40-50-60% ranges. Success ranges from 30 to 70% from lab to lab. It is not 100%. Okay. Is it clear to all of you? Okay, Sanjay Kumar, got it? So this is in nutshell. So all of you, this is not expected for your MCQ. Okay, just all of you remember this. Okay, when will I do IVF? Sir, when the tubes are blocked or the sperm count is less than 5 million per ml. Okay, less than 5 million, but still a good count. 1 million, 2 million, half million. Eggs or ovary stimulated with injections, then the egg is picked up and then the embryo transfer done on day-to-day. Generally 2 to 3 embryos are transferred in the uterine cavity. Is this clear to all of you? Okay, so that is the meaning of IVF. Okay, so in IVF, basically you can see this is done. Okay, so you take the egg, this is the thing, that the egg is there and on top of it 50,000 sperms are put. Any one of them will enter. Okay, now what I'll explain to you. Give me 2 minutes. Now what will we do? What will I do if the sperm count इससे भी कम है? 5 sperm, 50 sperm, 100 sperm, that's it. Because for IVF at least 1 million या 500,000, 5 lakhs. अभी उससे भी अगर स्पर्म काउंट कम है, 5 स्पर्म्स, 100 स्पर्म्स, देन IVF का बाप, यस, IVF का बड़ा भाई ICSI, इंट्रासाइटोप्लाज्मिक स्पर्म इंजेक्शन, ICSI. ICSI stands for इंट्रासाइटोप्लाज्मिक स्पर्म इंजेक्शन, ICSI. Okay, ध्यान से सुनेंगे. All of you please pay attention. Everything is like IVF only. It is like IVF only. Like IVF step number 1, the eggs injections are given to ladies and eggs are sucked out. So like IVF, the eggs will come outside the body. This 5, 6, 7, 8. Now in IVF, what is done? 50,000 sperms are put on top of each egg. Now here I don't have 50,000 sperms. I don't have means I have, patient does not have. Okay, so what is done is one egg is taken, one sperm is taken, and mechanically one sperm is injected into one egg. That's it. Rest of the procedure absolutely similar like IVF. So put this embryo in the incubator, and then in the next month or whenever the patient is ready, we will go and do the embryo transfer. So ICSI के बाद भी embryo transfer तो करना है. So last step is always embryo transfer. Is this understood to all of you? So embryo transfer is the last step for both IVF as well as ICSI. Is this understood to all of you? Yes. So when the sperm count, इसका मतलब क्या है? All of you please pay attention. See this. Okay. The steps are identical to IVF, but for the fertilization, one sperm is mechanically injected into one oocyte. Okay. इसका मतलब क्या है? Please pay attention कि अगर today if I have a patient, इसके पूरे बॉडी में, yes I'm repeating, okay Kanil, that sir, if today I have a patient, in his whole body there are only 5 sperms. Okay, whole body there are only 5 sperms. Theoretically, technically, today he can have 5 babies. How? Sir, 5 eggs from the female taken, 5 sperm, one sperm put in 1 egg. Okay, 5 embryos are ready, and then all embryos one by one you can transfer and she can have babies. Is this clear to all of you? So all this I'm not going to ask you, but please pay attention. Okay, so please pay attention that this is what is done in first look over here. This picture. Okay, first look on the upper side only, do not. Okay, so this is what is done in ICSI. This is the tool which you hold the egg. This we are seeing is the egg, and this is the needle, and with the needle we are injecting a sperm inside this. Okay, so this is exactly what you need to keep in mind, nothing more. Okay, so this all of you can see. Okay, sir, this is the egg and this is the needle, and one sperm is injected into the cytoplasm egg using the needle. Okay, and clap if you feel happy. This is the actual human egg. Okay, this is the tool, this is the holding device. You just have to hold the egg. Okay, that the egg will move around. So this is just a holding tool. Okay, so egg, this is done under microscope. Okay, all this is done under microscope. So this is the egg, and inside the egg this is the cytoplasm, and this is the sperm, and the sperm is injected inside the egg, and then egg and the sperm is embryo. This is the fertilization step. Okay, this step is we are creating egg plus sperm. Egg plus sperm dal diya, that will cause embryo. And then what is the last step? After the embryo is formed, what will you do? Yeah, I'm coming to that, but Kenil, I'm coming to that. Okay, I'm coming, that you will only tell me the answer. Egg and the sperm is embryo, and then what is the last step? After embryo is formed, what do you do? Yes, very good. Then you do the embryo transfer, ET. Embryo transfer. So please understand, students, it is understood that when you say, whether you say IVF and IVF ET mean the same thing. ET has to be done. Okay, so आप बोलो कि my patient went for IVF, that means IVF and ET. Similarly, it is also understood that ICSI plus ET, embryo, it's a part of it. Okay, it is understood. Okay, so now I want all of you. So now we are going to play a game. Okay, so इसका मतलब क्या है कि I'm going to make all of you experts in the see how the procedure is done. How the procedure is done, nobody is going to ask you. Okay, how the procedure is done, nobody is going to ask you the details. You should only know when to do which procedure. Okay, when you should only, how, nobody is going to ask you. But very quickly I'll just tell you again in IVF and ICSI. It's step number 1. Injections are given to female. You suck out all the eggs, so eggs are ready. Now on top of them, if I put 50,000 sperms on top of each egg, 50,000, 1 lakh, 1.5 lakh, that is your IVF. Okay, and if single sperm you take and single egg you take and only one sperm directly put inside one egg, that is ICSI, intracytoplasmic sperm injection, as the name suggests. Okay, क्योंकि at least 1 million 2 million तो चाहिए IVF करने के लिए. And the last common step for both of them is the embryo transfer. Easy, simple, ठोको ताली, clap if you feel happy. Okay. Okay, yes. So now all of you tell me the answer. So मुझे आप लोगों से यही expectation है exam में कि when to do which procedure is what you will remember. So now tell me the answer. Tell me the answer. What will I do? What will I do if I have a male, if I have a couple comes to us with infertility? Couple comes to us with infertility. And on examination, I found that the male sperm count is 10 million per ml. Husband sperm count is 10 million per ml, and the female fallopian tubes are patent. So what will I tell the patient to undergo? Clap for yourself, not clap for me, clap for yourself. Perfectly correct. Okay, sir, IUI is the answer because both the tubes are normal and I told you 10 million. So I told you 5 to 15 million है तो IUI करेंगे. Same thing. So 5 to 15 million के बीच में, can you say this 5 to 15 million and female tubes patent? So बेटा, this what you yourself don't know कि आप ये जो सब अपने आंसर चैट बॉक्स में all of you have written the answer correct. This is a 2027 next level MCQ. Today 2024, 24, 25, 4 साल के बाद का ये MCQ है. जो MCQs मैंने 2013-14 में कहा था कि 2017-18 में आएंगे, actually they have come. So that is what MCQs are predicted in 1920 will come after 2 years, that have come. So this MCQ will come in 2027. Okay, by the time all of you will have become postgraduate. Okay, so whenever there is an infertile couple and male count is 10 million and fallopian tube patent, then IUI. Now suppose I have a patient whose sperm count is say 1 million per ml, 2 million per ml, 0.5 in this range, 0.5 million per ml. Then what is the option? Anybody? Male infertile couple, female, okay, but male count is only 1 million per ml. Yes, then I will have to go for IVF. Or if I tell you both the tubes are blocked, okay, both, because one tube, okay, both tubes blocked, तो again option क्या है? Again IVF. Very good, ठोको ताली, excellent. Yes, IVF ET. And last thing, we have got a patient. Then forget about the wife, because if the count अगर ये है, then even if the tubes are open, that is fine. You can't do anything. Okay, so they'll just fool you. They'll say tubes are patent, but the count is also. And last is I have a patient whose count is very, very, very low, like 5 sperm, 100 sperm, 1000 sperms. That's it. Only 1000 sperm. Okay, 0.1. Okay, तो क्या करेंगे? मतलब 0.5 में. Yes, excellent. Clap for yourself. तालियां बजती रहनी चाहिए. इक्सी. Is this clear to all of you? So Kenil, Rahul, all those who are finding it, I'm going faster now. Is it absolutely crystal clear? Hashtag crystal clear concept in the please floated and absolutely crystal clear. Okay. Yes. Okay. Perfect. Okay. Yes. Super. Okay. So all of you, is it understood? Yes. So just remember, and all this, they are not going to ask you for sure is my guarantee. Just remember Okay, when at what count when you do. इसमें IVF details all that they're not going to ask you, but just for yourself, basically 3 steps होते हैं. We give injection to female with gonadotropins. Then second, we pick up the egg which is outside the body. We suck out the eggs. Then you mix the egg and the sperms together, which is fertilization. And last is you do the embryo transfer. That's it. Okay. So step number 1 injection, step number 2 suck out the eggs. मतलब सिंपल नट्स एक लाइन में एग ले लो, स्पर्म ले लो, इनक्यूबेटर में डाल दो, एम्ब्रियो को वापस यूट्रस में डाल दो. That's it. That is IVF. Okay, nothing more can be asked to you in any of the exam is my guarantee. The last thing is as a complication of IVF. So this is the ICSI. Okay, you can see injection of a sperm into the egg. So single egg and single sperm. Okay, this is ICSI. Okay, now please pay attention. Last thing, OHSS, ovarian hyperstimulation syndrome. This is a side. So IVF के आपके दो, one is twins, multiple pregnancy. So when we discuss twins, all of you should know this. And what is this hyperstimulation syndrome? That sir, I wanted 4, 5, 6 eggs, 10 eggs, but suddenly many eggs start growing. Okay, and mainly इसमें क्या होता है? Only one time this image has come. In the NEET PG, likely coming in FMG also, I'm showing you the image also, I will show you. Okay, so in this what happens, because of multiple eggs start growing, there is various mediators are released, histamine and your no beta Harry, it is not IVF is preferred more, it depends on the factors. Na? If I have a male patient whose count is only less, then I will have to go for IVF. So it is not IVF is preferred more, it will all depend on the situation. If the tubes are normal and the count is okay, then I will go for IUI only. Okay. So it will all depend on yes, but yes, your IVF is increasing more and more because more and more patients are having infertility, late marriage, eggs are getting less, endometriosis is increasing, PCOS is increasing. So yes, sir, you are correct. IVF has increased a lot because more and more patients are having infertility. That is absolutely correct. Okay. So here multiple mediators, interleukin, cytokine, ये सब आपको याद नहीं रखना है. This remember OHSS happens when it is almost never seen with that oral medicines. So clomiphene citrate के साथ letrozole के साथ नहीं होता है. It is mainly when you give this HMG injection or that recombinant FSH. And along with this, remember, forget the details, HCG injection is given. HCG injection is given as a final maturity for the eggs. To finally mature the eggs, you require to give HCG injection. Okay. Yeah, I'll tell you. Okay. So this, when you give this combination of HMG, FSH and finally HCG. Remember, HCG injection is given to the lady to make the egg finally mature and release. This is called a trigger because HCG acts like LH. Okay. Well, I told you LH is responsible for ovulation. So LH के जगह पे we use HCG. So HCG has got action like LH. Okay. So forget all the details. All this is PG level. So basically क्या होता है कि when HCG is given, so it's a most dangerous complication of ovulation induction, and vast majority of cases happen when gonadotropin are used and HCG is given for the final release of the oocyte. Yeah, correct. So to what happens beta, IVF costing again depends, but starting from 1 lakh, 1.5 lakh to 2 lakhs IVF can happen, 2 to 3 lakhs maximum. Yes, you're correct. Again, it depends from place to place. 1 to 3 lakhs. Okay, आप लोगों को खाली एक ही चीज याद रखना है. Patient will have ascites and big enlarged ovary. When they give you this history, forget the details. Okay, so basically in mild OHS, all this not expected. Mild OHS is just abdominal distension and there is ascites. Okay, and then as the OHSS will worsen, the hematocrit will increase, and finally the patient can also have renal function problem and DIC. Okay, VEGF, vascular endothelial growth factor, is implicated in the development of OHSS. Virgin MCQ 2027 next level MCQ के OHSS happens because of what? So various things, sir. प्रोस्टाग्लैंडिन्स, हिस्टामिन, साइटोकाइंस, इंटरलुकिन, ये सब implicated है, but VEGF is considered the most important. Okay, VEGF is the most important for the development of OHSS. Okay, so basically क्या है, ये picture आपको याद रखना है. Okay, so can you see this? See, this is the big ovary. This is the big bulky ovary. The history, I'll tell you what is the question given to you, and you can see multiple eggs, multiple big follicles are there. Okay, so multiple follicles are there in the ovary, and along with this, this is the sonograph. See, this is the uterus. ये जो आपको दिख रहा है, this is the patient's uterus, and all this black, remember fluid is black on USG. Okay, so all this what you are seeing black, all this black is the fluid. Basically fluid matlab it is ascites. Is this clear to all of you? So when this, but problem क्या है आप लोगों को, because examiner को पता नहीं है, वो खाली आपको ये एक image देंगे. In the exam only this one image was shown to you. But actually this image should also be given to you साथ में, because along with the multiple eggs growing, there has to be development of ascites, which the examiner is not giving you in the exam. That's an incomplete question. But if you see, this is there, okay? Because you will see there will be abdominal distension and there will be ascites. So mild, moderate, severe. Ascites matlab free fluid. Free fluid matlab this only. Okay, ये जो black fluid दिख रहा है. Okay. सो क्वेश्चन क्या था आपको एग्जाम में, क्लैप इफ यू फील हैप्पी. क्वेश्चन इतना ही था कि अ लेडी अंडरवेंट ओव्यूलेशन इंडक्शन, इतना क्लियरली हिस्ट्री दिया था. लेडी अंडरवेंट ओव्यूलेशन इंडक्शन विथ गोनाडोट्रोपिन इंजेक्शंस, विथ गोनाडोट्रोपिन थेरेपी. इवन ये भी नहीं दिया था खाली. ओके, सो इट इज वेरी रेयर. सी क्लोमिफेन साइट्रेट वेरी ओकेजनली, but majority is because of gonadotropin. So a lady, हाँ बेटा, I'll come to that. बेटा Kenil, वो मैं आपको सिखाने. Before you ask me, I know which questions you're going to ask and I'll tell you, and you will only tell me the answer in a minute. Okay, Kenil? Okay. તો Kenil but ગુજરાતી છે બેટા, હમણાં તમને જ આન્સર કહેશો તમે મને 2 મિનિટમાં. Okay, now play attention. Okay, so क्या एग्जाम में होगा कि सर the history of multiple history of ovulation induction medicines taken and ovulation injection taken and this picture. So this you mark it as OHSS. Okay, okay, multiple eggs are growing in the ovary, but this is actually a incomplete picture, whereas this also should be shown to you that there is development of ascites. Okay, so when you see a multiple big ovary like this, multiple eggs, and along with this you see free fluid, that is ascites, free fluid or ascites in the pelvis. That is what you will mark. Anybody, what is your diagnosis? If you see this picture in the ovary and along with that they'll tell you free fluid and ascites in the pelvis, what is our diagnosis? OHSS. Okay, now very simple, please pay attention, common sense. What is the excellent, all of you, superb. FT, Chitranjan, Sanjay, Sadhya, Nijita, Prasad, Rishi, Imodin, Poppy, all of you. Okay, now can anybody tell me very simple and logical के PCOS में क्या था? सर PCOS में multiple small follicles arranged in the periphery. कितना था follicle का size बेटा? 12 or more than 12. How much size follicle in PCOS? 12 or more than 12 follicle. What size? Anybody? PCOS, yesterday revision. Clap for yourself. कल सिखाया, आज रिवीजन, जिंदगी भर नहीं भूलोगे, एटलीस्ट एग्जाम के दिन तक तो नहीं भूलोगे, मेरा गारंटी है कि यस. सो कैनिल बट नाउ यू गॉट द आंसर कि सर इन PCOS द मल्टीपल स्मॉल फॉलिकल्स आर देयर एंड ऑल द फॉलिकल्स आर 2 to 9 millimeter in size, and they are in the periphery. They are in the periphery of the ovary. Okay, so कैसे simple याद रखना है कि sir, when you get this multiple, I'm showing you this picture कि sir, these are all small follicle size, visual में भी समझेगा, and see they are only in the periphery of the ovary, and छोटे 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 necklace of pearl, that will be PCO. Yes, PCOS आपको एग्जाम में देंगे as a confusion, correct. Both will be there because you will feel ovulation induction done. And here the difference, my dear students, is that here there is a not only ascites, big follicle, and all coming in the center also. Pura ovary, yes or no? Can clap if you feel happy. Can you see both the pictures? And along with this, ascites, actually they don't give in the exam, but ascites should be there. That is OHSS. तालियां बजते रहनी चाहिए. Okay, so can you see this clearly, beta? Okay, these are all not only in the periphery, they are coming even in the center. See, this ये बड़े follicles हैं, and they are all throughout the ovary. Okay, all throughout the ovary. So, which image, beta? Harry HB. Which image you want me to show again, beta? Harry. This OHSS. I'm showing you the image. Yeah. Okay. Is it clear to all of you? Yes. So do not get confused. Do not get confused. You will get this multiple. So these are all, remember, finally, all of you, multiple big follicles. Okay. Multiple big follicles, even in the center. Okay. Multiple big follicles coming in the center also. Center may be hai. Center also. Okay. In center also. Plus there is development of ascites. This is ascites. That is OHS. Multiple big follicles coming everywhere. Okay. Yes. And PCOS is only the small periphery, small follicles. Okay. So I hope nobody will teach you like my guarantee, and you will easily get all your marks is my guarantee. तो पूरा ओवरी ही आपको ऐसा दिखेगा. That is OHSS. Okay, nothing more can be asked to you in any of the exams is my guarantee. And let us go on to the most important topic for the day, and that is the topic of our amenorrhea, primary amenorrhea. Okay, contraception after the break, please. Okay, so anybody in amenorrhea, this HSG tubal patency already we have discussed. Okay, now anybody, what is the meaning of the word primary amenorrhea? Primary amenorrhea means patient has never got her periods. By the way, weightage and importance 1 to 2 MCQ sure, 100% guarantee. Without this topic, MCQ paper is incomplete. FMG, NEET, PG, INI, CT, whichever may. Yes, very good. Patient has never got her periods. Very good, Bilal. But never got periods till what age? Never got periods till what age? हाँ, 13, 15, 14, 15, 16. Okay, so now please pay attention, all of you, lifelong अभी पहले ध्यान से सुनेंगे. Okay, most of you should know. Okay, all of you please pay attention. Thelarchy, pubarchy, menarchy. That means first there is development of breast. Thelarchy मतलब breast, then axillary pubic hair, and then the menses start. TPM. Okay, so please pay. So there is breast development, axillary pubic hair development, and then the menses start. Okay, now very, very important. This MCQ is surely coming. Why? Because the criteria has changed very, very recently. Okay, very, very recently the criteria has changed. Okay, so now all of you please pay attention. Okay, sir, suppose I see a girl in the OPD and breast development has already started, axillary pubic hair has already started, then I can wait. Yes or no? I can wait for the menses to start. जैसे वो राखी कर्ण अर्जुन मूवी में राखी हीरोइन मेरे कर्ण अर्जुन आएंगे, कर्ण अर्जुन आएंगे आएंगे, वैसा. So similarly, menses आएगा, menses आएगा, menses आएगा, you can wait. That means if thelarchy and pubarchy are present, this is called as, in short form writing, secondary sexual characters, SSC. Okay, I repeat, development of breast and axillary pubic hair is called as secondary sexual characters. So if secondary sexual characters are already present, then I will wait till 16 years of age. ध्यान से. Okay, I will wait. But this is old. Don't remember this. I'll wait whether menses are starting. But if I see a girl in the OPD and there is no axillary hair, no pubic hair, no breast development, that means secondary sexual characters are absent, then even at the age of 14 years, you will directly label the patient as primary amenorrhea. But this has changed now. This is the old definition because the age of menarche increase ho raha hai. We are decreasing by one year and the 14 has now become 13 years and the 16 has now become 15 years. Is this understood to all of you? All of you, thumbs up. So the definition is, so if I tell you, okay, so now tell me the answer. Which of the following is the definition of primary amenorrhea? Okay, that there is no menses, patient has never got her periods. Okay, 11 years age, patient is 11 years and not yet got her periods. 13 years and secondary sexual characters are present. Just a second, all of you. Yes, chalo. A, B, C, D. Tell me the answer. Yes, all of you correct. So 11 years mein to we will definitely wait. 11 years mein I will wait. 13 years and secondary sexual characters, this also you will wait. You can wait till what? Because the secondary sexual character already started developing. You will wait till 15 years. Okay, and this was the old. Okay, sir, there is no secondary sexual characters and 14 years girl happened. That is the old definition. Is this understood to all of you? So the best answer over here is, sir, she's already 13 years and there is no secondary sexual characters. That is the answer. Or if there is secondary sexual characters, so this is basically the answer. This is the definition, all of you. Okay, I'll show you the definition in a minute. Uske pehle one more MCQ. If I ask you the most common cause of primary amenorrhea. Androgen insensitivity syndrome, RMKH syndrome. चलो, हाँ बेटा, पीसीओएस आंसर में ही नहीं है, ऑप्शन में ही नहीं है पीसीओएस. एंड बेटा प्रशांत, पीसीओएस विल कॉज नो बेटा. दिस आर द ऑप्शंस. ऑप्शन देख के आंसर करेंगे. इम्परफेक्ट में क्रिप्टो में ना, वेरी रेयर. इम्परफेक्ट वेरी रेयर. Okay, A, B, C, D. I want options chat box. D, yes. Okay, so all of you, please pay attention. Please pay attention. Pregnancy, we will discuss in a minute. Pregnancy is the most common cause of secondary amenorrhea. Pregnancy is going to cause secondary amenorrhea. Okay, and primary amenorrhea in order of frequency. In order of frequency, this is the most common. This is number one, Turner syndrome. RMKH is number 2 and androgen insensitivity is number 3. Okay, is this understood to all of you? And all of you, don't worry, all this ये सब क्या है, you will become expert in the next 1 hour is my guarantee. ध्यान से सुनेंगे, very interesting chapter and 2 marks are in your pocket for sure. Okay, so first of all, please by heart this slide is a 5-star slide. All of you read loudly. All of you read loudly. In beta, repeat idhar hai beta, this is the repeat slide. Okay, in the absence of secondary sexual characters, no menses till the age of 13 years, and in the presence, no menses till the age of 15 years. Is this understood? Tell me yes. Now, the most common cause in order of frequency, number 1, Turner syndrome or ovarian dysgenesis. Number 2, RMKH, Rokitansky, Meyer, Kushner, Hauser or Mullerian agenesis. And number 3, androgen insensitivity or testicular feminization syndrome. Don't worry, ये सब all of you will become expert in the next 30 minutes. अभी टेंशन मत लो, अभी खाली पहले 1, 2, 3 नंबर याद रखो. Okay, and each and every patient of primary amenorrhea karyotyping should be done. Okay, that is the most important thing. So karyotyping should be done. Why? All that we will discuss in a minute. Okay, RR understood? Tell me yes. ये सब क्या है, ये सब क्या है, ये सब हम एक्सप्लेन करेंगे. That is what I had written over here. Okay, Turner syndrome is the first most common cause, RMK second most common cause, AIS third most common cause. Okay, now please pay attention, and this is the definition clear, all of you. So please remember, in the exam you will only forget the figures 14 and 16. 14 and 16 याद नहीं रखना है. This is the old criteria. 14, 16 remove. Please keep in mind 13 and 15 years. 13 years in the absence of secondary sexual characters and 15 years in presence of secondary sexual characters. Okay. Okay, and please remember, in order of frequency, the 3 most common cause: Turner syndrome or ovarian dysgenesis, RMKH or Mullerian agenesis, and AIS or TFS. Okay, now step by step. Pehle point number 1. Anybody, what are the features of Turner syndrome? Turner syndrome, what are the features? So all of you know, short stature, web neck, wide carrying angle, okay, shield shaped chest, no breast development. Why? I will tell you in a minute. Basically, ovary का streak ovaries. Remember, streak ovaries. Streak ovary का मतलब क्या है basically? कि ovaries replaced by fibrous bands. Yes, ovaries are just replaced by fibrous bands. Okay, basically मतलब non-functioning ovary. Ovary is not working. Okay, that is the meaning. Ovary is not working, and that is the reason all estrogen deficiency. So short stature, therefore no breast development because breast requires estrogen. Okay, so basically remember that there is no estrogen. Okay, but now tell me, all of you, if I say, एक second, all of you, if I say, tell me, Turner's syndrome, uterus is absent. True or false? True or false? Turner syndrome, uterus is absent. false. Excellent. Okay, very good all of you. Okay, यही बात याद रखना है कि टर्नर सिंड्रोम is not absent uterus. Uterus is not absent. टर्नर सिंड्रोम में ध्यान से सुनेंगे, uterus requires estrogen for its growth. Uterus requires estrogen for its growth. Estrogen is coming from the ovary. So there is no estrogen, and therefore the uterus is chotu or chintu or hypoplastic. Chintu uterus. Okay. So uterus is chintu, but uterus is not absent. Uterus is present. Okay. Hypoplastic chota chintu uterus. Okay. Hypoplastic or small or underdeveloped uterus, but the uterus is present. Just remember this, Turner syndrome is not absent uterus. Is this understood to all of you? So खाली इतना याद रखेंगे कि ovary is absent, streak ovaries, so no estrogen. No estrogen, I am writing, so no estrogen, so all the features, so breast development will not be there, short stature, okay, shield shaped chest, widely spaced nipple, and hypoplastic uterus. Clear, easy? Have all of you understood this? Tell me yes. Tell me why in the chat box. I want 10 why. खाली इतना याद रखना है, short stature होगा, streak ovaries, web neck, shield shaped chest, wide carrying angle, ये सब एग्जाम में दिया होगा, and no breast development but uterus present. Okay, and all of us know what is the karyotype? 45XO. 45XO is the karyotype. Please remember this. Okay, now can anybody tell me what all structures in female does the Mullerian duct give rise to? Mullerian duct in female gives rise to what? तो मुलेरियन डक्ट ध्यान से सुनेंगे फ्रॉम अबाउ डाउनवर्ड्स, वो फ्रॉम अबाउ डाउन. मुलेरियन डक्ट विल गिव राइज टू fallopian tube, uterus, cervix, and the upper part of the vagina. One of the most important statements of my whole lecture, ovary is not a Mullerian derivative. Ovary is not a Mullerian derivative, so lower vagina bhi rahega. Okay, yes, so therefore remember कि whatever is in the red, yes, whatever is in the red will be absent. मतलब fallopian tube absent, uterus absent, cervix absent, upper vagina absent, but ovary perfectly normal. Ovary is present also, and it is perfectly normal. Ovary is normal both in structure and function. This is your RMKH, Rokitansky Mayer Custer Hauser, where it is absent uterus, absent this. So clap if you feel happy. ये exactly इसका opposite हो गया. RMKH, here uterus, ovary beta is derived from gonads, primitive gonads. Ovary is not a Mullerian derivative. Ovary is derived from gonads. Okay, so ovary, यहाँ पे uterus क्या लिखेंगे? Anybody? Uterus should I put? Now tell me. And ovary. Uterus should I put tick or should I put cross? Uterus में क्या होगा? Cross. Uterus absent. And ovary perfectly tick. Clear? Yes. Excellent. Okay, excellent. ध्यान से. Okay, more things coming up in a minute. Okay, or more things coming up. Yes, uterus absent, ovary present. So please understand, technically it is opposite. Can you appreciate both of them are opposite nature? Both of them are opposite nature. सर यहाँ पे ओवरी क्रॉस है, यहाँ पे ओवरी टिक है, यहाँ पे यूट्रस क्रॉस है, यहाँ पे यूट्रस टिक है. टिक स्मॉल है लेकिन टिक है. ओके, सो यूट्रस टिक बट स्मॉल, यूट्रस एब्सेंट. ओवरी टिक, ओवरी क्रॉस. ओके, नाउ ध्यान से, anybody, as the name suggests, what is this Androgen insensitivity syndrome. Where is the problem? नाम में ही आंसर है. Androgen insensitivity. नाम में ही आंसर है. Any idea? Where is the problem? Androgen insensitivity syndrome. No androgen receptor, receptors are there. Okay, receptors are insensitive. Okay, so yes, so basically yes, so androgen is there, very good. Receptors, androgen cannot do its function. So either androgen receptors absent, correct, LSD, but better would be that sir, they are insensitive. It's a receptor level problem, very good. They all are disorders of sexual. Okay, so basically in androgen insensitivity, testosterone is present. Okay, testosterone is not absent, testosterone is present, but it is useless. It's a receptor level problem. Receptors are not there, or receptors are insensitive. Okay, that means that no, aromatization is okay. Okay, किनाई ध्यान से सुनेंगे. So basically क्या याद रखेंगे एक लाइन में, निकम्मा टेस्टोस्टेरॉन. टेस्टोस्टेरॉन कोई काम का नहीं है. ओके, टेस्टोस्टेरॉन है लेकिन वो कोई यूजलेस टेस्टोस्टेरॉन निकम्मा है. जैसे निकम्मा दिल, निकम्मा टेस्टोस्टेरॉन. टेस्टोस्टेरॉन इज यूजलेस, इट इज नॉट एबल टू फंक्शन. टेस्टोस्टेरॉन इज insensitive. Androgen insensitivity syndrome. Testosterone is a receptor level problem. Testosterone cannot act on the receptors. Receptors are not sensitive. Okay, so now can anybody tell me, ध्यान से सुनेंगे, when the person of androgen insensitivity is born, doctor will say congratulations, a girl child is born, because at birth the genitalia will look like female, the external genitalia will look like female. So the doctor will say congratulations, girl child is born, लड़की पैदा हुई. She will go to girls school, she will go to girls college. Please understand, height, weight, body habitus, breast development, everything like a perfectly normal female. Okay, please understand, they are like models, supermodels. By looking at the patient, you can never tell कि इसको androgen insensitivity है. बात समझ में आ रहा है? By looking at a person, you can never say कि इसको androgen insensitivity है. They are perfectly height, weight, body habitus, all perfectly like a normal female. Most of the time, the diagnosis is only made at the age of 15-16 years, when the girl's mother will bring her to the OPD and said that, sir, my girl has not yet got her periods. An intelligent doctor like all of you will do the karyotyping. I told you, karyotyping. और फिर राज खुलेगा या mystery will open up. What is the mystery will open up? कि ये तो लड़की नहीं, ये तो लड़का है. That person is a boy, XY. It is actually a boy. Okay, and RMKH is XX. Okay, so please pay attention. Please pay attention. Okay, in androgen insensitivity syndrome, it is XY. Yes, most important, and this is XX. And अगर XY है तो gonad present is testes. Testes are present, not ovary. Okay, and now I want all of you, wherever you are, ध्यान से सुनेंगे, wherever you are, please read this line loudly. All of you read this line loudly. In the entire, ये line जोर से पढ़ेंगे. समझ में आ गया कि sir, there are only in the whole OBGY only two conditions where there is primary amenorrhea, absent uterus, and that is RMKH and AIS. Okay, so here also the uterus is cross, uterus is absent. Is this testes are present? Our testes are undescended. Why? I will tell you. So this master chart, lifelong you will not forget. This master chart will help you solve many MCQs in the future. I repeat, and then all of you will type in the chat box yes or no, you have understood this or not. In order of frequency, this is the first most common cause of primary amenorrhea. this is the second most common cause, this is the third most common cause. ये बाय हार्ट करना है. यहाँ पे कैरियोटाइप 45XO, यहाँ पे XX, XY by heart. Here streak ovaries, all of you know, so no estrogen, streak ovaries, but streak ovaries, no estrogen. Yes, very good. Thank you, Falak. Thank you. Yes. Okay. Yes. Okay. And streak ovaries, but not absent uterus. Turner's syndrome, it's a hypoplastic uterus, but here the uterus is present. Because absent uterus दो ही condition है, RMKH and AIS, both uterus absent, but here ovary is perfectly normal, and here testes are present, testes are undescended. Is this understood to all of you? Yes. Okay. Furthermore, I will tell you. So please pay attention. When you get in your exam, more this we are coming to how to differentiate, will tell you in a minute. Okay. So when you get in your exam, मुझे आप लोगों से यही expectation है कि when you get primary amenorrhea and absent uterus, what are the only two things possible in the whole world? Excuse me. When you get primary amenorrhea, absent uterus, only look at excuse me, only look at these two options only. Whatever may be option 3, option 4, don't even bother looking at. Yes, whatever name they may give you, Kalman syndrome, Klinefelter syndrome, XYZ, कोई भी नया syndrome भी आने दो, sir, it will be either RMKH or AI. Superb, excellent, all of you. Congratulations. Yes, is this clear? Thank you, Harry. Okay, sir, primary amenorrhea, absent uterus, only these two are the possibilities. You will, yes, MRKH or RMKH of myelogenesis and AIS androgen syndrome, also called as testicular feminization syndrome. Okay, don't look at option 3, option 4. Okay, now how to differentiate further will also tell you in a minute. Okay, is it clear? तो पहले ये याद रखेंगे. Now, most important point कि यहाँ पे there is ovaries, यहाँ पे testes is the inguinal region. Okay, now please pay attention. All the girls in the classroom, all the girls, normally in females also, normally in female, the axillary and pubic hair is androgen dependent. Normally in all the females also, axillary and pubic hair is androgen dependent. So RMKH is a normal female. XX, the ovaries will secrete testosterone. Adrenal gland will also secrete testosterone, and they will have well-developed axillary and pubic hair. This is the main difference in the MCQ. And here, axillary and pubic hair will be absent. Forget sparse, absent. Is this understood to all of you? I repeat, यहाँ पे नाम में ही आंसर है, androgen insensitivity. Just remember, so testosterone cannot function. बस उतना लिख दो. If testosterone cannot function, all the testosterone will not be able to act. So if the testosterone cannot act, ध्यान से सुनो, axillary pubic hair will be absent. That's why please understand this, that whenever, that is when even the doctor says a girl child is born, congratulations, doctor is not at fault. Because actually the penile shaft does not enlarge. The penis looks like small clitoris. The scrotum does not fuse. It looks like labia majora, because all that is function of testosterone. And that is why the name testicular feminization. Okay, sir, actually there is testes, but rest all feature feminine. Rest all feature feminine. That means ध्यान से सुनेंगे कि axillary pubic hair will be present, axillary pubic hair will be absent. Now, whenever there are Mullerian problem, other associated problem like renal, skeletal, vertebral defects and deafness may be present. That is not the case over here. So, whenever there is a Mullerian problem, kidney problem हो सकता है. Kidney problem मतलब के your horseshoe kidney, one side absent kidney, skeletal vertebral defects and deafness may be present. Okay, is it clear to all of you? Okay, now ध्यान से सुनेंगे. Breast is well developed in both of them. How and why? Breast यहाँ पे भी tick, यहाँ पे भी tick. How and why ध्यान से सुनो. Common sense, sir. Column number 1 is a normal female. Ovary will secrete estrogen. Yes or no? Ovary से आ गया estrogen, and this estrogen will cause the breast to well develop, like all females. Because RMKH is ovary is normal. I told you, isn't it? I told you, ovary is perfectly normal. Ovary is normal. So estrogen is going to be plus plus plus. So estrogen आ गया तो breast development होगा. Yes, but uterus is absent. Now can you tell me why over here also the breast is well developed? Why over here in second column also the breast is well developed? Yesterday I told you, okay sir, the testosterone is present. It is not testosterone absent. Testosterone is present. Testosterone cannot act. Testosterone cannot act because it is androgen insensitivity. But testosterone in the peripheral adipose tissue will get converted to estrogen, and that estrogen is causing the breast development. Actually, it is gynecomastia. It's XY. It's a boy with a breast. Yes. Peripheral aromatization. I told you, remember? Yes. Okay, sir. Aromatization. But aromatization falak I told yesterday in the lecture. You have to see yesterday's lecture. Correct. Aromatization is testosterone to estrogen production, and mainly it is in the ovary, but part of it is also in your adipose and your peripheral fat tissue. Okay. So in the peripheral adipose tissue, the testosterone will get converted to estrogen, and therefore estrogen will cause the breast. So दोनों cases में breast is because of estrogen only. दोनों cases में breast is because of estrogen. Here it is ovary secreting estrogen, and here in the adipose tissue, testosterone to estrogen conversion, peripheral aromatization. Even if you don't remember that, that is okay. You can just remember breast well developed in both the above cases. Okay, breast is well developed in both the above cases. Okay, ध्यान से सुनेंगे. I'll tell you the features in. I'll revise it in a minute also. So in short आपको क्या याद रखना है? Please pay attention. That बेटा के भरत आचार्य, why are you late? No problem. Please pay attention now. And go and see the recordings also. Okay, so now all of you please pay attention. कि second column क्या है? Second column is actually a boy, XY. Second column is actually a boy who right since intrauterine life has never been exposed to testosterone. उसको टेस्टोस्टेरोन का एक बूंद भी नहीं मिला है, बट मिला है तो सिर्फ मिला है ईस्ट्रोजन. सो इट इज लाइक अ ईस्ट्रोजनाइज्ड मेल. Okay, it is actually like a male only. Not actually, the person is actually a male only, but never been exposed to testosterone. That's why please understand this. What does testosterone do? Causes the beard, mustache to grow. Testosterone causes the voice to change. Testosterone causes the breath. So body structure. That's why all that will not happen, and only the person is getting estrogen. So body curve like female, voice like female, skin ekdam glowing, estrogen. No acne, no, so they are like supermodels. Okay, if you have seen House MD, do you see House MD? That a medical thriller, House, Dr. House. In that one episode was there of this patient only, and that was actually a supermodel, and that was then found out that it was having testes. If you recollect. Okay, कभी देखा है तो देखना, वरना बाद में अभी मत देखना, एग्जाम के बाद देखो. House MD, in that one episode, this is the picture. Okay, so please understand this. Now, is it absolutely crystal clear to all of you? Is understood to all of you? Okay, sir, the patient, and therefore the testes will also remain undescended, because whatever is the function of testosterone will not happen. Okay, so see, testosterone क्या करता है? Yeah, we are taking a break, beta. Rishi, we are taking a break in 5 minutes only, 5-10 minutes. Okay, 10:30 we started, 9:30, 11:30. Yeah. Okay, all of you look on the board. Okay, what does testosterone do? Sir, testosterone causes the testes to come down, testes to descend. So ये नहीं होगा. So therefore उसमें क्या होगा? Undescended testes. Testosterone causes the voice to change. वो नहीं होगा. Testosterone causes axillary and pubic hair development. Okay, so वो भी नहीं होगा. Okay, is this clear to all of you? So testosterone normally, sir, causes axillary pubic hair development. That will not happen. Testes to descend. That will not happen. So whatever is the function of testes will not happen. Is this understood to all of you? Yes. So now tell me, okay, so I very quickly, all of you pay attention. I repeat, in the entire OBGY, only two conditions of primary amenorrhea absent uterus, and that is RMKH and AIS. Okay, RMKH and AIS, because Turner's syndrome, the uterus is present. Turner's syndrome, hypoplastic uterus, but uterus is present. So uterus absent, uterus absent. Okay. Very quickly, the difference XX, XY, ovaries present, testes present, but in the inguinal region. Axillary pubic hair present, axillary pubic hair absent. This is the most important in the exam. And renal vertebral defects present, absent. Okay. So now all of you tell me the answer. Okay. Now all of you tell me the answer, and then after 5 minutes, after 10 minutes, we are going on a break. Okay. Now all of you tell me the breast well developed in both the cases. Now this is the question for all of you. एक मिनट यहाँ पे हम हाँ बैठ सब बता रहे. ओके. Okay, so now in the chat box 1 2 3 4 option है primary amenorrhea absent uterus. ध्यान से सुनेंगे. breast well developed, breast tick tick tick, and on examination axillary and pubic hair absent. Chalo, flood the telegram with the answers. तालियां बजते रहनी चाहिए. Axillary and pubic hair, sir. Axillary and pubic hair is absent. Breast is well developed. Axillary pubic hair is absent. That means androgen is not working. Testosterone is not functioning, and therefore the answer is androgen insensitivity syndrome. Okay. And now suppose only one. So the whole question will be same. 15-year-old girl has been brought to the 15-year-old girl, brought to the OPD by the mother. Let whoever can bring, mother, father. The girl plays football very nicely. वो सब students वैसे करते हैं. Sir, she is playing football. तो ये होगा answer. She is playing cricket. नहीं. She is very good in exam. Intelligence, very good. Primary amenorrhea. On USG, the uterus is found to be absent. And now on examination, breast is well developed and even axillary and pubic hair is well developed. Now what is your answer? MCQ change. Superb. Okay, so when sir axillary and pubic hair is well developed, this becomes the answer. So simultaneously we are doing all the MCQ discussion also. I teach in all the three fashion. Images also I am showing. Wherever yesterday PCOS endometriosis image भी दिखा दिया, theoretical concept बता दिया, MCQ भी solve कर दिया. Nothing more required. Okay. Of course, we are going to have a test and discussion session later on also in the month of May also. We are going to have only MCQ discussion also. Okay. Is understood to all of you. Last 5 minutes. Okay. So in RMK, the axillary pubic hair is going to be axillary pubic hair is going to be present. Here axillary pubic hair is going to be absent. Okay. Yes. Okay. Yes. Now coming to the treatment and management, what somebody was asking, can RMKH patient have their baby? Can they have a baby? Can they have a child? Yes. Absent uterus? No. They cannot have their own biologic. No, no, no. Why no? Why no? वेरी गुड LSD पॉपी एब्सेंट यूट्रस संजय कुमार लेकिन सोचो किन्नई वेरी गुड के सर absent uterus perfectly correct all of you uterus is absent but the ovary is perfectly normal so they cannot deliver their own child. They cannot become pregnant themselves and deliver, but they can have their own child by surrogacy. Okay. Okay, sir, reproduction is possible with surrogacy as the ovaries are perfectly normal. मतलब ध्यान से सुनेंगे क्या करेंगे. All of you pay attention. Okay, all of you pay attention. Okay, surrogacy, just for example. Okay. Okay, your all the Mimi movie had come recently. Kriti Sen on Mimi. इसमें proper surrogacy was shown. Or if you're seeing that Friends sitcom, in that Phoebe was acting as a surrogate mother and all that. Okay. Latest Shilpa Shetty, Amir Khan, Shah Rukh Khan, all they had their last babies with surrogacy. So क्या करते हैं ध्यान से सुनेंगे कि सर ओवरी में से एग लेते हैं. Like just I explained to you IVF. You take ovary में से egg, husband sperm, IVF done, and the last step in IVF is what? एम्ब्रियो ट्रांसफर. तो अगर अपने पास यूट्रस नहीं है तो भाड़े का यूट्रस और यूट्रस ऑन हायर, दैट इज सरोगेसी. Okay, take someone else's uterus. Okay, is this clear to all of you? So please understand this, that in column number 1 in RMKH, the reproduction is possible if they want, because the ovaries are perfectly normal. They can have their own biological child with surrogacy. Okay, that means you take this RMKH lady, who is XX, RMKH lady who is XX, her ovary, I will take the eggs. Take the eggs from the ovary, so they can marry, take the husband's sperm, create a pregnancy, and the embryo transfer is done in the surrogate uterus. Is this understood to all of you? Can I get 10 thumbs up? Okay, so surrogacy. Now, abhi isme do cheez aur. Please understand this, that whenever I say surrogacy, whenever we say surrogacy, IVF has to be done. Whenever we do surrogacy, it is through IVF is understood. Okay, the male partner cannot go and have sex with the surrogate. अरे वाह मजा, ऐसा नहीं होता है. Okay, the male partner cannot have sex with the surrogate. Okay, it will be this lady's eggs, husband's sperm. The surrogate enters into the picture only at the time of embryo transfer. So the surrogate will only put the embryos in her uterus and carry the pregnancy, and it's a legal contract, and deliver, and then she has to give the baby back. After delivery, she has to give the baby back. Is this understood to all of you? So the male partner cannot have sex with the surrogate. Then it becomes the baby of that male and the surrogate. तो ऐसा नहीं करना है. Okay, so please understand this. 1990, I'm just telling you, I think before all of you were born also, 1995, 1996, a movie had come, चोरी चोरी चुपके चुपके. Okay, ध्यान से सुनेंगे. सलमान खान, रानी मुखर्जी, प्रीति जिंटा. Okay, चोरी चोरी चुपके चुपके, name of the movie was there. SK is Salman Khan, RM is Rani Mukherjee, PZ is Preeti Zinta. Rani Mukherjee can't have kids for whatever reason. So Salman Khan goes and has sex with Preeti Zinta. Arey wah, very good. And then Preeti Zinta delivers and gives the baby back. That is not surrogacy, that is adultery. Okay, that is adultery, that is not surrogacy. And बहुत hype किया रहा है. We are making a film on surrogacy. 1995 हल्ला मचा दिया था कि हम लोग सर India's first film on surrogacy. Bullshit, crap, कचरा. That is not surrogacy. That is adultery. एंड दैट इज वाई स्टूडेंट, ये सर एडल्ट्री था, इसलिए तो नाम था, इसलिए तो नेम था, चोरी चोरी चुपके चुपके. ओके ओके ओके, चोरी चोरी चुपके चुपके सब हो गया. ओके, that is not surrogacy, that is adultery. This is a film about adultery. Okay, extramarital sex, polygamy. Okay, is it clear to all of you? Okay, is it clear to all of you? So that is just for your knowledge that whenever we do surrogacy through IVF is understood. Okay, it is always through IVF. Okay, so please you can go and tell all of you, nobody will teach you like this, is my guarantee. Okay, is it clear to all of you? So this abhi last point and then we are going on a break. So यहाँ पे हो गया हमारा काम कि here I will do surrogacy and IVF. Now what about our second? But good news was IVF, उसमें surrogacy नहीं था, but yes. Okay, now anybody. Okay, now anybody. What about our second column patient? अभी इसमें क्या करेंगे? Now please understand this. In this second column, when you make the diagnosis of XY, you can't tell the patient तुम लड़के हो. Yes, तुम लड़के हो statement is correct, तुम लड़के हो, but imagine till 16 years of age, 15 years of age, you have been reared up like a female, isn't it? We told the patient, you are girl child is born. You gave her girl's clothes, girl's name, girl's school, girl's college. Suddenly you can't say, from tomorrow, you are not a girl, you are a boy. Okay, till yesterday, your name was Deepika. Now from today, your name is Deepak. Or till yesterday, you are Punita. From tomorrow, you are Punit. No. So you have to continue rearing them as females. Okay. Because they are assigned the sex of female at birth. So at birth, the genitalia will look like female. And that is why, imagine, that's why they'll come to gynec OPD. Otherwise, why will a boy come to a gynec OPD? So at birth, we have assigned the sex of female. The genitalia, external genitalia will be looking like normal female. And therefore you say girls clothes, girls college, girls school. But yes, the testes are lying in the inguinal region. I am not happy with that. Why LSD? Why would I do orchidectomy? Why I would remove the testes? Yes, absolutely correct. The testes I would want to remove the testes. Why remove the testes? Risk of cancer. Okay, risk of malignancy is there in the undescended testes, gonadoblastoma, seminoma. So remove the testes. And if I remove the testes, ध्यान से सुनेंगे, if I remove the testes, वो टेस्टोस्टेरोन ही है जो ईस्ट्रोजन में कन्वर्ट हो रहा है. Yes or no? I told you testosterone cannot act, and testosterone in the peripheral adipose tissue, aromatization is getting converted to estrogen. So I will also give them estrogen replacement therapy. Very good, Sanjay Kumar. Estrogen replacement therapy देंगे. And you can also do a vaginoplasty for them because they can marry. And they can have sexual activity. They will act as a female partner because remember, otherwise they are perfectly normal. By looking at a patient, they can become doctor, engineer, model. Their height, weight, body habitus, body count, they are like supermodels. So they will act like a female partner in the marriage. You can do vaginoplasty for them so they can even have coital activity. Okay, so please ध्यान से सुनेंगे, reproduction is not possible but gonadectomy should be done because risk of malignancy, yes, risk of cancer is there, and vaginoplasty and estrogen replacement therapy are required. Is this understood to all of you? And breast is well developed in both the cases I have explained to you. That is not the difference. So primary amenorrhea, absent uterus MCQ आया, दो ही चीज पे आपको ध्यान देना है. Breast will be well developed, axillary pubic hair present है, mark RMKH, axillary pubic hair absent है, mark TFS और AIS. That's why the name test, नाम में ही आंसर है, testicular feminization. कि सर टेस्टिस है, रेस्ट एवरीथिंग फेमिनाइन. समझ में आ गया? दैट्स व्हाई नेम सो इजी टू रिमेंबर नाउ. कि सर टेस्टिस आर प्रेजेंट, टेस्टिकुलर, बट रेस्ट एवरीथिंग इज फेमिनाइन. हाइट, वेट, बॉडी हैबिटस, ब्रेस्ट डेवलपमेंट, वॉइस, एक्सटर्नल जेनिटलिया, एवरीथिंग फेमिनाइन. ओके, बिकॉज टेस्टोस्टेरोन कैन नॉट एक्ट. सो सर उनको एक बूंद भी टेस्टोस्टेरोन का नहीं मिलता है तो सिर्फ मिलता है ईस्ट्रोजन. कैन आई गेट 10 thumbs up? इज दिस अंडरस्टूड टू ऑल ऑफ यू? Is this table clear to all of you? And is this table clear to all of you? Okay, so primary amenorrhea, absent uterus when you get, only keep of these two things in mind. And the last thing we are going, and I hope you have the difference is very clear. And here you just have to keep in mind about the extrapubic hair, and here keep in mind that reproduction is possible by surrogacy because ovary is normal, but here on the second column you will remove the testes and then give them estrogen replacement therapy. Okay, the last thing, many of you are already present yesterday, but just for the information, please all of you, this is the YouTube channel. All of you, those who haven't subscribed till now, please go and subscribe to the YouTube channel. Okay, and also to the Instagram of the this OG Guru. So all of you can please quickly go and subscribe to the my YouTube channel of OG Guru, where lots of interesting facts, lots of short videos are there, lots of interesting MCQ discussion videos are done. January FMG recall session is also there. Okay, so all thumbs up, and those who haven't yet subscribed to the YouTube channel, please do it right away, and also subscribe to the Instagram. And more details about the app and all that we'll discuss after the break in some time. Okay, so it is 11:15, a break for 10-12 minutes, and 11:30 is when we start. Okay, so 12-13 minutes break. And yeah, thank you beta, and all of those who haven't subscribed, please subscribe now. And yeah, break for 12 to 13 minutes. Okay. Hello, hello, hello. Hello, hello, hello. Yes, so I think okay. So is the audio video all clear? Can all of you hear me? Can all of you see me? Yes. Okay. So welcome to the session. Very, very important. We have discussed something about primary amenorrhea and IOFXC. Based on this, surely. Beta, yesterday notes also we had already sent to the tech team and they will upload it. Okay. So today's notes also will be sharing it to the tech team immediately after the session and they will post it on the app. Okay. So through the app, you will be getting the notes. Yes. I have sent yesterday notes also I have sent. Okay. Yes. So now, uh, quickly settle down, all of you. Okay, okay. I'll try to do that, but let me do that in the. Yeah, I will try to do that, and I'll try to write more on this side. Okay, so no problem. Yes. Okay. Thank you. Yeah. Yes. So now please pay attention. We have discussed very important topic of primary amenorrhea. Please keep that in mind. Definitely the question comes on that topic. Next, equally important topic, cryptomenorrhea. Now, anybody, what is the meaning of cryptomenorrhea? Crypto matlab hidden. Okay, I will show you the image also later on. Okay, so crypto matlab hidden. So what happens over here? Basically, hidden periods. Okay, cryptomenorrhea matlab hidden periods. Surely the MCQ on this also comes. So what happens over here is mainly. So there is uterus, there is cervix, there is vagina, and basically imperforate hymen. Okay, so one of the most common example is your imperforate hymen, where the hymen is completely blocking the blood from coming out. Okay, so now anybody, what will happen? Okay, so at the normal age 11, 12, 13 years, the blood will actually start to come out from the cervix. But because the hymen is imperforate, what will happen? They will come to us with primary amenorrhea. Remember this, कि sir, periods कभी start ही नहीं हुआ है. Along with it, they get pain. So primary amenorrhea and cyclical abdominal pain. This is the clue in the question paper. Clap if you feel happy. Cyclical abdominal pain दिया है. Cyclical abdominal pain because every month they get pain. Okay, but along with it, primary amenorrhea. Okay, yes, that there is no external bleeding, but all symptoms are there, like how crampy pain. And what happens? Blood will get collected inside the vagina. This is called as what? Hematocolpos. Okay, this is called as hematocolpos. Okay, and then as the blood will get collected inside the uterus, this is hematometra. And can anybody tell me, yesterday I taught you these patients in the long term, chance of which more disease? Blood can go retrograde. So they have got more risk of which condition? Anybody? Yesterday revision. Very difficult MCQ, virgin MCQ. Patients of cryptomenorrhea have got more chance of which disease? Very good, Vijaya. Endometriosis, because retrograde menstruation is going to be more, so they have got increase. And very good, RR. Okay, cyclical. All of you correct. RR, Shaheen. Yes, excellent. Kennel, all. Okay, and very important. Very important. They also then, as the blood, what is the classical bluish purplish? On examination, you will get bluish purplish tense bulging hymen. Okay, so if this is all the question paper, and here uterus will be present. See, if you do a sonography or if you do a per rectal examination, you will see, let's say, the uterus is present over here. Uterus is filled with blood. So uterus is present. They present primary amenorrhea, cyclical abdominal pain, tense bulging hymen. Okay, all these are the clue given to you in the exam, and you cannot make it wrong. You cannot mark it wrong. You cannot get it wrong. Okay, tense bulging hymen, which is the condition of imperforate hymen. Can anybody, and more chance of, and what is the treatment for this? What is the treatment for this? What you have to do? And yes, two things. One important point, this uterus can become slightly big. So you can also have a suprapubic bulge. And do not forget, this hematocolpos will press the bladder, and they can get urinary retention episodes, because that is confusing to the students. Okay, urinary retention. They can come to the OPD with urinary retention. Okay, they can come to the OPD with episodes of urination. Very good. And not incision and yes, not yes. But Shaheen, incision and drainage used for any abscess. So you are almost correct that basically, but a cruciate incision, you just put a cross sign. So if you put a cross like a cut over here, the flaps will open up and all the blood. So the cut which you make will cause the flaps to become like this, and then all the blood will come out. Okay, so don't forget this urinary retention. Please mark 3 star. Okay, if they tell you patient has primary amenorrhea and cyclical abdominal pain and urinary retention episodes, that is your imperforate hymen. Can anybody tell me one more condition where I can get cryptomenorrhea? So basically it is nothing but outflow tract obstruction. So all outflow obstruction. Okay, all outflow obstruction will have the same thing. So all of you, yes. So it could also be cervical stenosis, or it could also be transverse vaginal septum. अगर ऐसा transverse completely blocking है, okay, not a longitudinal. So any other outflow obstruction can also cause. Okay, so basically outflow obstruction. Any outflow obstruction will cause what? Cryptomenorrhea. Okay, and I'll show this picture also, image. It's in the other people I'll show you. Okay, so cryptomenorrhea. Is this clear to all of you? Can I get 5 thumbs up? So very simple MCQ, 5 minutes topic. Don't make a mistake. So either it could anywhere blockage. Okay, it could be anywhere. So the block could be imperforate hymen, transverse vaginal septum, cervical stenosis, wherever there's a block, uske piche blood will get collected. So hematometra, hematocolpos, further blood in the tube, hematosalpinx, all that, and cyclical abdominal pain, tense bulging hymen, and episodes of urinary retention. Suprapubic bulge, because uterus may become big, there could also be bladder. So uterus ka thoda size बढ़ता है, तो they can also have suprapubic bulge. And sonography में uterus is present. Okay, now the next topic, we will start with the topic of contraception. Secondary amenorrhea is almost never asked, but I will nevertheless discuss it at the end of the class today, or sometimes I will also discuss it. Very important topic of contraception. Okay, now in contraception, different methods of birth control are there. Contraception, again 2 to 3 MCQs for sure. Okay, because one on OCPIL, one on IUCD will come for sure. For the different, you remember 3 to 4 things. We should know for contraception what is the mechanism of action, whether it's a barrier method, whatever. What is the failure rate by heart? Okay, I'll tell you for everything. Okay, so mechanism action याद रखेंगे, failure rate याद रखेंगे, and third, you will remember all the other uses and benefits other than birth control. And lastly, if there are any contraindication, I'm writing CI. Okay, so हर method हम discuss करेंगे. mainly तीन है. Your OC pills, IUCD, injectable, your DMPA injections, and then we'll also discuss about the emergency contraception, very important. And also I will discuss MTP in this topic only. MTP, all the new guidelines, 100% questions are coming on this. Okay, so the topic of discussion for the next 1.5 hours for till 120 is contraception only, and MTP whatever will finish, and we'll continue in the post this also. Okay, is it clear to all of you? And primary amenorrhea I have done, cryptomenorrhea I have done. Secondary amenorrhea topic, very small, but I will discuss it nonetheless, don't worry. Okay, so let us begin. The first and foremost is the male condom, or the anybody, how does it act? What's the action of male condom? How does it act? It is a barrier method. Okay, barrier matlab it prevents the union of egg and the sperm. Okay, egg and the sperm union, it will prevent. Okay, now anybody, if I ask you the failure rate of male condom, chalo, failure rate of male condom, 1 2 3 4 ABCD. Gopinath. Okay, so all, yes. So please understand, 1 to 2 is nahi. Condoms have got very high failure rate. That is the disadvantage. 1 to 2 is for OC pills or even IUCD. Okay, so the technical number 4 to 14%. So you have to always remember like a range. Okay, so in the exam, so 18 to 25 is very high. C is of course lesser. So 4 to 10% is the best answer to mark over here. Yeah. Yeah. Is it clear to all of you? Yes. So please by heart this, 4 to 14% is the failure rate for the male condom. Okay. Now, and it's a barrier method. Now, can anybody tell me what are all the other uses and benefits of the condom? Where else condom can be used? Okay. So one, what else? Prevention of STDs. What else that everybody knows? Uske alawa? Yes. Where else? Yes, that everybody knows. Prevention of what else? What else? Where else can I use condom? Just three more. Three more I want all. Very important, interesting. Virgin MC. Okay. Anybody? So, and have you seen sonography being done? Which? So transvaginal sonography. Whenever I do transvaginal sonography, the probe is covered with condom. You cover the probe with a condom. Very good. Use it for one patient and then throw it away and use it again. Perfectly correct. Okay. Yes. Okay. Next one. Yeah, HIV, all that is correct. HIV, STD, all that. Next, very important. Anybody, condom, tampon. Please don't tell me to make balloons for Holi. Abhi Holi aane wala hai, okay? Sir, I will use condoms to make balloons. No. If you don't have money to buy balloons, then you can use condom. But basically remember, okay, a tonic PPH. Whenever there is a tonic PPH, अटोनिक पीपीएच का मतलब क्या है? दैट all of you pay attention. This is the uterus, and after delivery it is not contracting. So I will take a red rubber catheter, just take a red rubber catheter, tie a condom on top of it and put it inside the uterus, and now connect this to a saline. So what will happen is that the saline will inflate and give a condom tamponade. Clap if you have learned something new. This has been devised by Dr. Shivkar from JJ Hospital, Mumbai. So this is called as Shivkar's pack. So even if you don't remember the name, it is okay, but you should just remember three things. Prevention of STDs, all of you know. Will teach you in medicine. There's something called as condom catheter, which we can use in male patients. Cover the transvaginal sonography probe, and Shivkar's pack, condom tamponade for atonic PPH. That's it. Baki sab forget it. Okay. Live got stuck? I don't think so. Everything is okay from my side. Yeah. Is it clear to all of you? So please pay attention. And in anti-sperm antibody in the cervical mucus, you can tell the male patient to use condoms for some time. After vaginoplasty probe, all that you forget it. Just remember three. Prevention of STDs, all of you know. Condom catheter in males, transvaginal sonography probe, and tonic PPH. So basically, why I teach this gynac before now, you know that next week, next Monday, Tuesday, when I teach you the topic of PPH, you will tell me this back as one of the treatment option. Okay, sir, I will use condom tamponade packing for tonic PPH. Is this understood to all of you? Have all of you understood? It's like a balloon, it's like a tamponade, okay, for tonic PPH. Okay, so these are the uses which you should know. And failure rate 4 to 14%, I told you. Now anybody, what is the difference between female condom and a diaphragm? Any idea? Female condom and a diaphragm, what is the difference? Okay, so female condom and diaphragm, same or different? Anybody? Okay, so please pay attention. The difference is female condom and diaphragm. Female condom, outer ring, inner ring. Okay, outer ring open, inner ring closed. Okay, yes, very good. RR. Okay, Jeff, very good. So female condom will cover the whole length of the vagina. This is the vagina. So the female condom will cover the whole length of the vagina. This ring is outside at the introitus. The male partner will insert the penis from here, and intercourse takes place in the cavity of the condom. And suppose ejaculation takes place here, then the further entry of the sperms is prevented because this side is closed. Please don't use it ulta, वरना problem हो जाएगा. And then here is the uterus, and here is the cervix, and here is where you place the diaphragm. So the difference is very, very important. That sir, the female condom covers the whole length of the vagina. Diaphragm only covers the cervical opening. Diaphragm covers the cervical opening. Okay, so all of you can see this picture, very important. Okay, see, one ring is open, one end is closed, and you push it inside the whole vagina, outer ring, inner ring, and this. Okay, so we are supposed to the female is supposed to wear it at the time just before the intercourse. Okay, and diaphragm is exactly like this. Okay, yes, one open, other side closed. Yes. Okay, and diaphragm is exactly like this. Just it just covers the cervical opening. Okay, so diaphragm is just like a spoon, like a katori or a vati, which is there to cover the cervical opening. अभी failure rate याद रखना है. Male condom कितना था? Failure rate male condom 4 to 14%. Female condom thoda more, female condom slightly more. Okay, it is like around 8 to 18%, around 18% is what you can remember, 15, 18, 17, 18. And diaphragm usse bhi zyada, 18 to 25% almost. Okay. Okay, now two things. Anybody? Well, that is what I'm going to ask you. Okay, so that is the question. That diaphragm, you insert it anytime before the act of sex. Now, this is the question: when to remove the diaphragm? When to remove the diaphragm after the act of sex over? Immediately? Yes. So remember, do not remove immediately. Please remove only after they say 4 to 6 hours or 6 to 8 hours. So roughly remember 6 hours is when you remove it, and never use it more than 24 hours. Why? What can happen if you use diaphragm for more than 24 hours? Risk of toxic shock syndrome, virgin MCQ. Okay, toxic shock syndrome. Okay, so which birth control can cause toxic shock syndrome? Remember, diaphragm, if kept for more than 24 hours, can cause toxic shock syndrome. Okay, is this understood to all of you? 24 hours से ज़्यादा रखेंगे तो toxic syndrome, and this is generally combined with spermicidal agent. Okay, so is this understood? So remember, do not remove immediately. 6 hours or maximum you can keep for 24. Okay, so max 24 hours. Okay, max, if you want to keep, then remember, max we can keep it inside for 24 hours. Don't use more than 24 hours because risk of toxic shock syndrome. Very good. Okay, the last thing which I want to tell you in this, and then we go on to the other things, is that there is एक brand name है. Brand names we are not supposed to remember, but there is a vaginal sponge. Okay, this is a vaginal sponge. It's like a ring. The patient is supposed to just push it inside the vagina, and this is a vaginal sponge. Confusion, very very old MCQ. Many years back this question had come, but I'm just teaching you. Iska brand name है Today. Today is a brand name. Okay, actually brand name you are not supposed to remember, but Today vaginal sponge, it is what? So many patient feel the vaginal sponge is a barrier method. No, this is not a barrier method. This contains a spermicidal agent. Okay, this contains a spermicidal agent, nonoxynol 9. Okay, even if you don't. Okay, nonoxynol 9 is a spermicidal agent. Basically the sponge के अंदर, okay, inside the sponge there is spermicidal agent, and with the moisture of the vagina the spermicidal agent is released, and the patient is supposed to put the sponge before sex, and after the act of sex remove the sponge. Okay, लेकिन student feel कि ये sponge है, so they will say it's a barrier method. So question ये आता है, question comes is this: Today vaginal sponge is, it's a barrier method. IUCD method, spermicidal diaphragm. No sir, it's not a barrier method. It is not a spermicide. It is not IUCD or OCPIL. It is a spermicidal agent. Is this understood to all of you? Thumbs up. Okay, so this covers all our basic thing. of our diaphragm and today vaginal sponge and your male condom, female condom. Okay, is it clear to all of you? Can I get 5 thumbs up? Yes. Moving on to the next very important IUCD, intrauterine contraceptive device. Now, anybody, what is the meaning of first generation, second generation, third generation devices? Anybody, what is first generation, what is second generation, what is third generation devices? And what is the mechanism? Chalo, start telling. What is the mechanism of action? And also tell me the failure rate. Very good. Lipis lupus which generation beta? Correct. Very good. Okay. So point number 1. Very good, Bilal. Okay. So mechanism of action is it is a foreign body. Okay. Basically it's a foreign body reaction and common sense like वो क्या बोलेगा कि मैं uterus में हूँ. Okay. I am inside the uterus. So I will not allow the pregnancy to come. So basically makes the yes. Okay. Fertilization ज़्यादा basically makes the uterus unsuitable for uterine implantation. I'm putting a cross. Okay, that is how it's a foreign body reaction, makes the uterus unsuitable for implantation, and your failure rate very effective. Okay, very effective method. Okay, 0.5 to 1.5% only. Okay, so by heart rate 0.5 to 1.5. Now coming to the question, what is first generation, second generation, third generation devices? Yes, all the inert, this is no longer available. First generation devices, example lipis loop, all the copper, जहां जहां पे copper है, I will give you all the names. Okay, copper T, copper T 200, copper T 300, multi load, all that we will discuss. All the copper T as well as multi load, I will tell you what is ML, what is multi load, I will tell you. All that is second generation, and third generation are the ones which release hormone, progesterone and Mirena. 100% MCQ is coming. Progesterone is banned. We'll discuss this later on. Progesterone is no longer available. Progesterone is banned and no longer available because it was causing more ectopic. We'll discuss that in our ectopic class. But this is no longer available. But Mirena is definitely the most king of IUC. Okay. Anybody? Another name for Mirena? Actually, Mirena is a brand name. So we are not supposed to remember the brand name. What does it? What is the another name for Mirena? Yes, perfectly correct. Perfectly correct. It is called as LNG intrauterine device, LNG IUD. We'll discuss more in detail in some time. Okay, so it's also called as LNG IUD and all the other things I'll discuss. Okay, so now point number 1, mechanism of action पता चल गया है. Foreign body reaction, failure rate we know 0.5 to 1.5%. Okay, now anybody, the copper pictures I'm showing you in a minute. Now, this LNG IUD, 2 questions. Total, how much LNG? Chalo, Total, how much LNG does it contain? LNG in the chat, in the box. Answer. Total LNG content. It was asked 2 years back. Very good, Bilal. Yeah, no problem. Okay. So, two questions. Please don't get confused. One is total LNG, and second is how much LNG is released per day. Okay, how much is released per day. Okay, so remember students, totally it contains 52 milligrams, and I call it also LNG20. Why I call it LNG20? LNG is levonorgestrel. Okay beta, Farhan Faiz. Okay, LNG stands for levonorgestrel. 20 microgram per day. Very good, microgram. So don't get confused. 20 microgram unit है per day है, and total is in milligram. Okay, so both the question. Yes, and hence okay. So the students got confused. Both options were there and they interchanged. Simple था लेकिन they made, and effective for 5 years. And what is the best part? Failure rate best. Okay, only 0.09. So clap if you feel happy. Clap if you feel happy. एक slide 4 MCQ, 4 से 5 MCQ. What does it contain? LNG. That's why it's also called as LNG20, or some people also call it the LNG intrauterine system, IUS. How much LNG it contains? 52 milligram. How much released per day? Okay, how much released per day? 20 microgram. Okay, effective for how long? Effective for 5 years, and failure rate 0.09 to max 0.1. You can remember 0.1. So जो copper T का था, copper T was 0.5, उससे भी कम. Okay, least, one of the least failure rate. Okay, levonorgestrel intrauterine system. Okay, so in like in 1 minute, 5 MCQs I can discuss. All 5 MCQs have come in the exam. Okay, is it clear to all of you? Question number 1. What does it contain? LNG, levonorgestrel. How much LNG total? 52 milligram. How much per day? 20 microgram. How long it will stay? 5 years. And failure rate 0.09. Okay, so all these we should know. 0.09 to maximum 0.1%. Okay, and therefore we also call it as LNG20. Okay, and Myrina is a brand name. Okay, now very important. Can anybody tell me, today Myrina is used more and more for its non-contraceptive benefit? Where else can I use Myrina? And think, if I continuously put, when I put Myrina in the uterus, what will happen to the menses? Anybody? When we insert Myrina inside the uterus, what happens? And what are all the different benefits and uses of Myrina? Any idea? Very good. Chitranjan, how it will reduce the blood loss? So ध्यान से सुनेंगे, all of you please pay attention. It's sir, Myrina is progesterone, correct? Myrina is releasing progesterone. Now progesterone is opposite of estrogen. Progesterone is opposite of estrogen. Estrogen causes the lining to grow. So progesterone, when I give continuous progesterone, it does not allow the lining to grow only. It does not, lining matlab the endometrium. So the lining is not growing, there's nothing to shed off. So what will happen is menses will become scanty, and menses can even stop. This is called as progesterone induced amenorrhea. And don't worry, this is perfectly safe for the patient because it is progesterone induced amenorrhea. Matlab kya hai? Please pay attention that the patients who have got heavy periods, painful, very good. Okay, so patient's bleeding will start coming under control, and as it's like continuous progesterone you are giving. So what happens when you're giving continuous progesterone? It does not allow the estrogen to act only. So all of you pay attention. Normal patients, what happens? So the endometrium lining will grow. Endometrial lining will grow, and then that endometrial will shed off in the form of menses. Okay, and then this much lining comes in the form of menses. If lining has grown very much, heavy periods. Now what happens when the patient I have put a LNG, when in a patient I have put a LNG intrauterine device? Very good, Poppy. Okay, that the lining is not able to grow only. The endometrium is going to remain very, very, very thin. आपको बात समझ में आ रहा है? So if the lining is going to be very, very thin, there's nothing going to come out. It's like all of you, please pay attention, clap if you feel happy, that I will shave only if the beard is growing. Then I will shave. If the beard is not growing only, Tiger Shroff, what will he shave? Okay, because many years back, remember, he came 10 feet high, the beard was not growing only. And he did some hair, okay, like that. Okay. So it's like a grass in the garden. Okay, only if the grass is growing, I have to cut the grass. If the grass is not growing only, what will I cut? Same thing. Okay, sir, because of continuous progesterone, the periods will start becoming less, and periods can even stop, which is called as progesterone induced amenorrhea. And is it harmful for the patient? No, it is not harmful, because in under lining is not growing only. So it is very safe, and therefore the menses will either completely become scanty. So either the menses can become scanty, or they can even stop. Either the periods, either the flow will become scanty, or basically menses will become scanty, or menses can even stop. Is this understood to all of you? Can I get 5, 10 thumbs up? Okay, so this is just for, nobody will teach you all this point, is my guarantee. It's only for my love for the subject I'm teaching you the mechanism. Otherwise, I will just say, this is how Myrina, this behind the uses. Okay, but understand that when I put progesterone IUD, menses will become scanty, and the lining remains, because the lining or the endometrium is very, very thin. Okay, endometrium is very, very thin. Yes, so therefore I can use it in all the conditions like menorrhagia, yes, painful periods, dysmenorrhea, adenomyosis, hyperplasia, cancer. It's progesterone, so it will prevent endometrial hyperplasia, prevent cancer. So 5-star slide, 5-star, and then I'll show you all the images also. Okay, I'm showing you all the images in a minute. Myrina or LNG intrauterine device. Okay, you will remember these points, that it is going to make the blood flow lesser. So I am going to help in patients of DUB or heavy menstrual bleeding, HMB, pain, dysmenorrhea will become lesser, endometriosis, adenomyosis, all the condition, fibroid, very, very important. I can use it and prevention and treatment of endometrial hyperplasia. Okay, and also decreases risk of endometrial cancer. And this, don't worry, I will explain you this more in the ectopic chapter also. That, sir, it will make the cervical mucus thick. Okay, cervical mucus will become thick. Cervical mucus will become thick. So PID, pelvic inflammatory diseases, will become lesser, and therefore ectopic will also become lesser. So Myrina protects against ectopic pregnancy. Those who use Myrina have got less chance of ectopic pregnancy. Okay, is it clear to all of you? So please, by heart, 5-star slide. 5-star slide. What are all the benefits? And just 4 याद रखेंगे: menorrhagia, dysmenorrhea, endometriosis, endometrial hyperplasia, endometrial cancer. Yes, is it understood? Can I get 5 thumbs up? Okay, these are the benefits. Just remember why? Because we are giving continuous progesterone. So continuous, if I give on giving progesterone, the lining will not develop only. So the lining will not develop, or the endometrium lining will not grow. Endometrial lining will not grow. Endometrial lining will remain very, very thin. So yes, correct. Main action is releasing progesterone to make the continuous progesterone prevents the endometrial growth. Okay. So therefore, we can use it in conditions of menorrhagia, dysmenorrhea. We can use it in conditions of all the other different conditions. Okay. Is it clear to all of you? Yes, so L and G will keep them. Okay, so now all the picture. Okay, so all of you pay attention. Point number one. Now this is, now before that one. Okay, so ye L and G ka I'll again show you once, then I'll show you all the pictures. Okay, is this understood to all of you? Yes. Just remember 4 uses. So I can use HMB stands for heavy menstrual bleeding. Heavy menstrual bleeding, or is another word for menorrhagia. Okay, so menorrhagia, dysmenorrhea, endometriosis, fibroid, endometrial hyperplasia, endometrial cancer. Prevention, and also protects against ectopic pregnancy. This slide will be repeated 2 more times. How, when, I will tell you in some time. Okay, this slide will be repeated 2 more times. Okay, is it clear to all of you? Now please pay attention. When in no, but PCOS में benefit, मतलब PCOS में दे सकते हैं EMAR, but in PCOS I'll tell you, we'll discuss yesterday. PCO, OCPL is better, because यहाँ पे क्या होगा, menses will stop ना. PCOS patients, they would want regular periods, and PCOS, they want treatment of acne hirsutism. So just wait for some time. I will tell you what is better for PCOS patients. Yes. Now, when you have anybody, when I say copper T 200, what does this 200 stand for? ये भी MCQ आया है. Copper T 200. But a DUB will discuss after the break. DUB is dysfunctional uterine bleeding. It's another word for menorrhagia only. DUB is dysfunctional uterine bleeding, which is, you remember, HMB, heavy menstrual bleeding, matlab menorrhagia. Okay. What is DUB? I'll explain to you after the break when the topic of menorrhagia. Okay, Navrad? 200 beta Bilal, 200 area, but 200 area of what? Surface area, very good. In how much? Kilometer, centimeter. So when you say copper T200, this is the vertical stem, and here the copper wire is wound around it. Okay, so when you have a copper wire, when you open the copper wire, yes, it is the surface area of the copper in millimeter square. So please remember this, when I say copper T200 contains 200 millimeter square of copper. Okay. Okay, so now please remember all the 3. Okay, so when, and anybody, there are threads at the end. The threads at the end will tell you help in removal, and threads at the help will tell you whether the copper is in position or not. We are coming to that in a minute. Okay, so copper T200 is very famous MCQ. 200 stands for the surface area of the copper in millimeter square. Don't make a mistake. Okay, surface area of the copper in millimeter square. Okay, now look at this picture, and it is completely white. Okay, so please remember this image based question, LNG, intrauterine device. The trick to remember this is that there is no copper wire. Can you see over here? There is no copper wire completely white color device. Okay, white color device, it's a hormone cylinder, and this completely white device is going to release LNG, levonorgestrel. Okay, Myrina is a brand name. It is also called as LNG, intrauterine device. Is this understood to all of you? So this is a MCQ likely to be coming in the upcoming exams. No copper, okay? And can anybody tell me? Okay, yeah, so ye ek ho gaya. Now if I ask you the question, longest acting IUCD, longest acting, copper T 200, multi load ML, multi load 375, LNGIUD, multi load 250, and copper T 380. Chalo, tell me the answer. Longest acting IUCD and how many years? So you can also get match the column. Very good, all of you. Very good. So remember, all of you, anybody, copper T 200, 3 years. Start, okay. Multi-load 375, anybody, what is multi-load? I will tell you in a minute, okay. Multi-load 5 years. LNG IUD, I just now told you 5 years. You can extend to 7. Okay, multi-load 250, again 3 years. And copper T 380, very good, 10 years. Also available in our government supply. And this, okay. Now, how will you identify anybody? How will you identify copper T 380? That's the answer. Image-based question. Image-based question. How will you identify? LNG I showed you. LNG is completely white, correct? So white device, when you say complete white, okay? When there is complete white and there is no copper. Now, anybody, how will I identify 380? So 380, remember students, is the only one where the copper T is also, the copper is also on the horizontal arms. Yes, there is a copper sleeve here and there is a copper sleeve here, apart from the copper wire which is over here. Is this understood to all of you? So, and how much copper on the side? Don't remember the numbers. याद रखा तो 33, 33. So this is 33, 33, 314. Okay. So all of you clap if you feel happy. This is the answer. Okay. So here there is 314 millimeter square, and this is 33, and this is also 33. So 33 plus 33, 66. 66 plus 314 will come to 380. Okay, 314 square copper on vertical and 233 millimeter square on each of the transverse arms. So एग्जाम में ये सब आपको MCQs है. Okay. So 33 plus 314 will come to 380. Okay. Yes, thumbs up. Yes, and the last one, what is this multi-load? नहीं, individual याद में रखो, but you have to remember 380 10 years. That you have to remember. Longest acting. Now, what is this multi-load device? Please understand कि बाकी सब device are T-shaped. So copper T will be T-shaped. Okay. Now multi-load का मतलब ये है कि it is like a serrated fins. Okay. So multi-load will look, I will show you the picture also, will look like this. Okay. Multi-load will have like this sun ray appearance. Okay. Common sense, आपको स्कूल में अगर कभी भी टीचर ने बोला है स्टूडेंट्स ड्रॉ अ सन, तो हाउ हैव आई ड्रॉन अ सन, हमने स्कूल में सन कैसे ड्रॉ किया है, ऐसे, करेक्ट, रिमेंबर, बस वैसा। तो वैसा अगर सन के जैसा है, so like this, so it is basically a copper device only, but it is not T shape. Copper is over here, copper is over here, and that is why, yes, and that is why you don't call it copper T, it is called multi-load. Can you see this multi-load? Okay sir, can you see this sun appearance, sun ray like this appearance, and like this, okay? So they are, it's a flexible serrated planes, and that this, and copper is only on the vertical stem, okay? And please understand this, both will look the same. By looking at the image, I cannot say whether, sir, this is multi-load 250 or multi-load 375. Both will look the same. Multi-load 250 and multi-load 375 will look the same. 250 is for 3 years, 375 is for 5 years. Is this understood to all of you? Clap if you have learned something new. So all 4-5 image based questions I have shown you. How does it act? I told you, foreign body reaction, and and uh, what we call, okay, uh, yes, so all types we have discussed. Now LNG IOD I showed you, and this, and also remember, don't forget the most important slide. I want you to remember this, the benefits of LNG. Just remember 4: menorrhagia, dysmenorrhea, endometriosis, hyperplasia, cancer. Okay, now very interesting two case scenarios which are going to be asked to you in the difficult NEET PG and NEXT and even FMG. That point number 1, all of you ध्यान से सुनेंगे. What are the threads for? So threads will tell me the position of the copper T. Okay, sir, the copper T is over here. Every time I can't do sonography, so copper T will stay like this, and the threads are seen coming out from the cervix. So when I do a per speculum examination, then I will come to know whether the threads are properly in place or not. Okay, whether the copper T is in place or not. So now the famous question, all of you, I had inserted a copper T for a patient few years back, and 2 years back or whatever, and now on per speculum examination, the threads are missing threads. ये थ्रेड्स हमको नहीं दिख रहा है. What are the possibility? Anybody? Tell me 3 possibility. Missing threads. Very famous MCQ. हाँ, copper displays where beta. What are the options? चलो, tell me 3 options. So one is, no, remove copper बेटा बाद में, remove तो बाद में पता चलेगा ना. अरे chance of about, हाँ, अरे I am not talking copper T with pregnancy. I am talking threads are missing. Copper T threads are missing. चांस ऑफ अबॉर्शन और वो सब जो आप बोल रहे हो अलग बात है. ओके, आई एम सेइंग यस प्रिया. ओके, कॉल्ड, वेरी गुड, goes to the yes. Okay sir, there are 3 options. Whenever the patient says that on per speculum the copper T threads are missing, all of you please pay attention. One is that the copper T is already expelled out, expulsion. ओके, तो उसका विच द पेशेंट मे नॉट बी अवेयर ऑफ. तो एक्सपल्शन हो गया, चलो ठीक है. You can again fit another copper T or give some other method of birth control. Or second option is that sir, the copper T is inside the uterus only, proper position, but the threads have curled up. Threads ऊपर चला गया है. Okay. And last, what everybody told me, very good, Poppy and Sanjay and someone told Priya, yes. Okay, sir, the copper T has, it's a very, please understand, it's like a, not like a shock. It's not like a ruptured ectopic. Okay, copper T very, very slowly goes up, 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 and it has either perforated the uterus and it is partly, or perforation happens mainly at the time of insertion, correct? Okay, it is partly or completely in the abdominal cavity, but the patient is never in shock. ये partly है, ये complete है, ठीक है. It is not case like a rupture uterus and it's a torrential bleeding. Gradually copper T बाहर आ जाता है and वो uterus अपने आप को seal भी कर देता है. Okay, now tell me, if the copper T is expelled out, nothing to worry. Now, if the copper, I'm talking of this question, okay, I'm talking of this, copper T is inside. Now, so what will you do next? So missing thread. So next kya karenge? What the next step, anybody? How will I know copper T is here, here, here or here? What the next step? Ultrasonography. Okay, so whenever the threads are missing, please do ultrasonography. Ultrasonography will tell you whether copper T is inside only or it is outside. Okay, now can anybody tell me if the, yeah, USG, okay, next USGS, okay, USG is better. Okay, now can anybody tell me if the copper T is here, this scenario? Okay, so I'm writing of A option 1, option 2, option 3, 3 possibility. Now 1 का कुछ, now 2, anybody case number 2 क्या करेंगे? Case number 2, can I wait and watch? Can I wait and watch in option number 2? Copper T is inside the uterus and threads are just curled up. Yes. So please understand, copper T is in proper place. So I can wait and watch. I can wait and watch. But whenever I have to remove it, yes, like yesterday I hysteroscopy. Okay, so you can wait and watch because copper T is inside the uterus only, can wait and watch, but then will require most of the time hysteroscopy to remove the. Please go and see yesterday's lecture, those who are missing or those who are absent. Fantastic class on hysteroscopy, laparoscopy. Now here, can anybody tell me, here can I wait and watch? Case number 3, case number 3, can I wait and watch? Yes, hysteroscopic removal whenever required, but you can wait and watch, huh? Now how many of you want to wait and watch in option number 3? Option number 3, wait and watch. No, why not wait and watch? Because why not wait and watch? Okay, why not wait and watch? Because sir, this is a foreign body. This is a foreign body, and copper T will cause intense adhesions and foreign body around this. Adhesions and intestinal obstruction can take place because of this. Okay, I'm writing IO. Intestinal obstruction can take place because of this copper T, and therefore never wait and watch. Okay, there is a risk of intestinal obstruction and adhesions. It's a foreign body inside the abdominal cavity, so never wait and watch. Okay, yes, okay, is this understood to all of you? So but then what will you do? How will I remove it? Anybody? So never WW. And chalo, tell me from yesterday's knowledge, anybody, how will option number 3, hysteroscopy or laparoscopy, क्या करेंगे use? Can any point doing hysteroscopy? No point, sir, because hysteroscopy is only for the cavity. Yes. So hysteroscopy करके कोई मतलब नहीं है. Excellent, all of you. We will have to go and do a terrace view. Terrace. याद आया कि नहीं? Clap if you feel happy. See how the concept. Yes. Okay, sir, it's in the abdominal cavity. So I will put in a telescope and through the laparoscopy first choice. Laparoscopy first choice, and if not, even laparotomy. Okay, if laparoscopy is not in the option, even laparotomy. Beta partial, it will not be like this. This also, once it is outside, Poppy, once it is outside, you'll have to do laparoscopy only. Yes, if it is in the uterus cavity completely, then you can do hysteroscopy. Okay, is it clear to all of you? Okay, so I repeat for the last time. Copper T, missing threads, ultrasonography to be done. Copper T expelled out, nothing to worry. Copper T is inside the uterus. Yes, you can wait and watch, but then whenever I want to do hysteroscopic removal, copper T outside the uterus, never wait and watch. Remember this, I've written never for WW, and go for immediate laparoscopy, or if not, laparotomy. No, both cases, why will I do laparotomy? Investigation, but USG, ultrasonography is investigation of choice. IO is intestinal obstruction. Okay, because of all the adhesions, intestinal obstruction can take place. Okay, Jeff, understood? In both cases, why will we do laparotomy, beta? Okay, if the copper T is inside the uterus, I will prefer to do hysteroscopy, na? What is the point of doing laparotomy? Here, laparoscopy first preferred. If laparoscopy is not in the option, then laparotomy. Okay, Poppy, is it clear to you? Yes, perfect. Okay, so IO stands for intestinal obstruction can take place. Intestine, okay? Intestinal obstruction can take place, and therefore never wait and watch. Yes, perfect. Okay, now the next very important, and then so you never wait and watch. So please read the question correctly. Whole question will be similar. Just remember copper T within the uterine cavity, copper T outside the uterine cavity. Okay, so please pay attention and don't make a. Yes, USG is used initially for both because USG will tell you here also, USG will tell you here also. So anywhere copper T is there, USG will tell you where is the copper T, and then you can decide what is to be done. Okay, next case, next scenario. Okay, is this clear to absolutely crystal clear to all of you? The next thing what you need to keep in mind is, so you will get a, now tell me the answer. Okay, option number 1 is, okay, so tell me the answer. Yes, 3 ऑप्शन आपके सामने है. Fourth is just forget whatever option. 3 options. Patient has come to you, per speculum threads are missing. Threads are missing, and on ultrasonography the copper T is within the uterine cavity. What I will wait and watch, but then how will I remove? Okay, how, what is to be done? No, extra lateral will not recover. USG is enough. Don't need to do X-ray. Okay. Yes, very good, all of you. If the copper T is within the uterine cavity, answer is hysteroscopic removal. Yes, you can wait and watch and hysteroscopic. And only one word if it is changed. All of you clap if you feel happy. Copper T is outside the uterine cavity into the abdominal cavity. Yes, perfectly correct, sir. If it is outside the uterine cavity into the abdominal cavity, then laparoscopy is the answer. Laparoscopy first preferred rather than to do laparotomy. Excellent. Yes, excellent. Both can be done, but B is better than C. Okay, so superb students, excellent. I hope all of you are enjoying the session and all of you are getting this knowledge and just all this MCQ is also getting discussed. Next thing is that patient has come to us, copper T is present and she has missed her periods. Copper T is in position. Copper T is in proper place. Patient has missed her period because copper T can fail. And the urine pregnancy test is positive. UPT, urine pregnancy test positive. So basically the scenario is copper T plus pregnancy together. Next क्या करना है? Difficult MCQ. Virgin for FMG. Any idea? Yes, anybody? Copper T with pregnancy, missed periods. Patient, copper T you had inserted 2 years back. Patient has now missed her periods and you do UPT. Remove copper T, give her choice for MTP. Okay, okay. USG, MTP, lap MTP. But why MTP? If she wants to continue pregnancy, yes. MTP if she wants to do, then you can do. But patient says, I want to continue pregnancy. Yes. Patient wants to continue pregnancy. Patient wants. Yes, only one student has thought, Kinai, very good. Okay, sir, to continue, not to continue, abortion, MTP, वो सब बाद में होता है. Whenever copper T fails, step number one, rule out ectopic pregnancy first. Is it clear? So here also ultrasonography to be done first because whenever the copper T, it's like copper T बोलेगा मैं यहाँ पे हूँ. Okay, see all of you assumed कि pregnancy मतलब वो uterus के अंदर ही है. No, sir, when the copper T is sitting over here, copper T बोलेगा मैं तुमको यहाँ पे नहीं आने दूंगा. Baby is trying to enter the cavity. Copper T says sorry, get out. I am here. So baby may get implanted over here, which is ectopic pregnancy. Okay. Yes, beta, that is lateral view X-ray with sound and copper. That is correct. That is when USG facility is not available. Otherwise, we don't do because only X-ray will not show you. So when USG, Bilal, you are correct. When USG facility is not available and threads are missing, then only X-ray has no point because X-ray only will not tell you whether the copper T is inside or outside. So then you put a uterine sound. It's a metal sound. I'll show you in the instruments. There is a sound, and that sound, when you put inside the uterus, the sound will have a metal shadow. Okay, sound will have a metal shadow. So आपने ये uterine sound is the device like this. So ये आप uterus में डाल दोगे. You put the uterine sound inside the uterus. This is a uterine sound. Okay, and then you take the X-ray, AP and lateral view. Because if you just take a X-ray and it tells you that copper T is here, ये copper T का shadow दिखेगा. How will you know it is inside or outside the uterus? Because this sound is made up of metal. तो sound का shadow भी आएगा. So sir, if the sound and the copper T shadow, example, so this is the T का shadow and this is the sound का shadow. So T and sound are superimposed, that means copper T is inside. So ये सब कोई नहीं करता, बड़ा कचरा, आउटडेटेड डस्टबिन हार्डली कोई करता है. और लेकिन आपका साउंड का शैडो यहाँ पे है और कॉपर टी का शैडो यहाँ पे है. Is it clear? So then you know, okay, sir, copper T you have put inside the uterus only. Sorry, the sound you have put inside the uterus. So sound is inside the uterus. Sound is in situ. इसको ये बोलते हैं in situ. Okay, is it clear? So don't get confused. All this is no longer done. But you are correct, Bilal. Is it understood? Yes, sir. When the copper T is missing, threads are missing. You remember USG. USG is not in the option. Then you can do X-ray with the sound in situ. So then you know, okay, sir, uterine sound is giving shadow over here. Uterine sound shadow is over here and T is over here. That means it is a perforation because uterus is like this. The sound is inside the uterus. Okay, so forget all this, nobody will ask you. Yes, so यहाँ पे very good all of you. You need to rule out ectopic pregnancy first. Don't always assume that the copper T will cause the pregnancy to be inside the uterus only. So first rule out ectopic pregnancy. Now if the copper T is pregnancy is showing intrauterine pregnancy, then you give patient the choice. If it's an intrauterine pregnancy, then patient choice. Is it clear to all of you? IUP stands for intrauterine pregnancy. Okay. So उसके बाद क्या? So patient says, doctor, I didn't want a baby. Please do MTP. Yes, I can do MTP. But my question to all of you is that patient wants to continue pregnancy. Now what will you do? Okay. So बात समझ में आ गया? बात समझ में आ गया? Question क्या है अब तक? Question is, copper T was there in place. Copper T is properly in place. Patient has missed her periods and there is pregnancy inside the uterus. Ectopic is ruled out. Intrauterine pregnancy. Now what will I do? Remove the threads or not? It means pregnancy is growing here and copper T is over here. Okay. Yeah. Yeah, only remove the copper T. Yes. Okay. So can I please pay attention? First thing is, yes, I will try to remove the copper T. Why? Because when the copper T and pregnancy is together, there is increased risk of infection and abortion. Abortion chances more and your infection chances more. So step number 1, I will try to remove the copper T. Okay. Try to remove. Okay, remove is the first best choice. 1 or 2 attempts can be made to remove it. But if you cannot remove it, not to worry. Keep the copper T inside only. What will happen? Will it cause any anomaly in the baby? No, sir, it will not cause any anomaly in the baby. Copper T will be there only. Copper T will be there only. What will happen? Baby will grow. And baby जब बाहर आएगा, वो copper T बाहर लेके डॉक्टर को हाथ में निकाल के दे देगा. Baby will bring the copper T out along with him or her. Okay, and copper T will come out with the baby. Matlab baby will not bring, but baby will bring the copper T out and give it to the doctor and show you. Okay, hello doc, see the doctor will open up baby's palm and another copper T will be there. Hey, see, this is the copper T and I'm giving you back. Okay, ऐसा नहीं होता है. Basically, baby will not bring the copper T out. What will happen is, that's only for joke. Okay, baby will come out first and then the placenta के बाद after, because baby will keep on growing. So copper T will push outside because copper T is outside the sac. Okay, so क्या होता है कि ये आपका यूट्रस है. Okay, and baby का जो gestational sac है वो grow होते जाता है. Gestational sac will keep on growing. So baby is always inside the gestational sac and copper T will be pushed outside on one side. Okay, so placenta के बाद, so baby will come out, placenta will come out, and then the copper T you will remove it. Yes, remove at the time of delivery. Okay, baby will not bring the copper T outside and give it to the doctor. Okay, that is not possible. Okay, is it clear to all of you? So I hope this is absolutely crystal clear to all of you, because this copper tea will not cause any harm to the baby. Remember this: copper tea plus pregnancy, no anomaly in the baby. Because many students say, okay, sir, it will cause baby में anomaly. Okay. Yes, chance of pregnancy is slightly more when the copper T failure is there. By overall with copper T, please understand this. When I discuss ectopic, I will clear this doubt for once and for all. Okay, students feel copper T causes ectopic. That's a false and the completely wrong kachra dustbin. Copper T never causes more chance of ectopic. Copper T failure, ectopic is more. Okay. Unlikely beta, because gestational sac is strong. It will keep on growing, and the copper T will get pushed to one side. Okay, so it will not cause anomaly in the baby. Okay, copper T plus. Is this understood to all of you? So first is you try to remove the copper T. Why to remove? To decrease the risk of infection, and abortion. Abortion chances are more. But if not, if you cannot remove, then the second best thing is wait and watch. Okay, is this understood to all of you? So copper T and pregnancy, there is no anomaly in the baby. You do USG to rule out ectopic, and then the patient choice. Patient says MTP, yes, I can do MTP. Okay, because it is failure of contraception. MTP can be done, and if not, you try to remove. Okay, is understood to all of you? Can I get 5 thumbs up? So missing threads में दो चीज याद रखना है. Threads are missing. Never you can do USG, copper T inside the uterus, you can wait and watch, or then hysteroscopy removal, copper T outside, never wait and watch, immediate laparoscopy or laparotomy. And copper T and pregnancy together, first rule out ectopic. Okay, rule out ectopic pregnancy first. Rule out ectopic pregnancy first, and then patient choice, and then decide what the patient wants. Patient wants to a patient wants to continue pregnancy, then try to remove the copper T is the first best option, and second best is wait. You can wait and watch. There is no risk of any anomaly in the baby. Post placenta, the copper T will come out. The last thing, what are all the contraindication for IUCD? Anybody? Contraindication. Very good. Ghanshyam, acute PID. Fibroid where acute PID. Yes, fibroid, but where fibroid within the cavity of the uterus. Yes, please pay attention. Okay, pregnancy. Very good. So इसके लिए पहले एक चीज. Now all of you pay attention. Those who are saying okay. Now all of you look on the board. Suppose this is the uterus. ये uterus है, and there is a chintu. There is a chintu 1 centimeter fibroid outside the uterus. Now can I put copper T in this patient? Yes, I can definitely put a copper T inside this patient. Okay, there is no problem because the cavity is okay. Okay, so this is becomes PG level, absolute difficult. But suppose all of you look on the board. If this is the uterus and there is a fibroid here, there is a fibroid here, there is a fibroid here, then all of you please pay attention. See how the cavity has got distorted. Can you see? This is a cavity which is completely distorted. Then I will not, the copper T will not fit properly over here, and then I should not put the copper T. Okay, so ये बहुत PG level हो गया कि fibroid outside the uterus, copper T can be put. Fibroid within the cavity, you avoid the copper T. Okay, now please pay attention. Virgin MCQ. What is the meaning of the word category 4? Category 4 question has never come, but just remember this is the WHO category, and category 4 is nothing but another name for absolute contraindication. Okay, category 4 is nothing but absolute contraindication. That means in the simple paper, the question will be absolute contraindication for copper T is. And in the difficult question, the question आएगा all students will get clean board. Okay, question खाली इतना ही होगा. Okay, category 4 for IUCD is. Anybody? Category 4 for IUCD is. Yes, all of the above. ठीक है, तो खाली इसमें यही है कि सर acute PID I will never insert a copper T, undiagnosed vaginal bleeding I will never insert a copper T, and uterine anomaly why common, all of you pay attention, like a 2 horns. तो कैसे कॉपर, like if it's a bicornuate uterus, which side I will put copper T, एक horn, 2 horn, so all of the above is the answer. But what is the meaning of category 4? So category 4, clap if you have learned something new. Category 4 is a fancy word for absolute contraindication. Okay, and a very important table, all of you will have to by heart it. Just remember 3 to 4: cancer, acute PID, vaginal undiagnosed bleeding, uterine anomaly, and also after vesicular mole, because after vesicular mole the uterus is very much this. So puerperal sepsis, anything in septic abortion, pregnancy, undiagnosed bleeding, sepsis, cancer, and your acute current matlab acute PID and following vesicular mole. Okay, and I told you uterine anomaly and fibroid with distorted cavity. I told you if the cavity is distorted. Okay, so please by heart this 5-star slide. You will have to mug it up. Okay, category 4 का मतलब है absolute contraindication. They will give you one from below. नीचे से देंगे nulli parity, no problem. Young patients just married, you avoid copper T, but copper T can be given in nulliparous also. Heart disease also you avoid, and fibroid with no cavity distortion are all even past history of PID. See, इसमें ectopic कहीं पे भी नहीं है. Remember, students will get confused. Past history of ectopic, I can use copper T. Are all relative contraindication. So there's no explanation. You'll have to mug it up. This table you'll have to by heart it. Okay, is it clear to all of you? So WHO category 4 is a word for absolute contraindication. Please by heart it. This is a 5-star slide which you need to remember. Absolute contraindication. Just the important ones I'm telling you. Anything to do with septic abortion, pregnancy is understood, undiagnosed bleeding, puerperal sepsis, cancer, uterine anomalies, and most important, acute PID, current PID or acute PID. And Vesicular mole, don't forget, this was asked 1 year back, that after vesicular mole, uterus is very soft. If you put copper T, risk of perforation. And fibroid with distorted cavity, I explained to you, if the cavity is distorted, there is a problem. Okay, and remember one thing, very important, ये आपका एकदम 100% क्वेश्चन आएगा. And nulliparity and fibroids and heart disease are all relative contraindication. मतलब you will definitely avoid, but डाल सकते हैं. Now anybody, can you tell me what is the full form of LARC? It's a very hot word today and ये MCQ आने ही वाला है. What is LARC? Anybody? Distinction gold medal question. What is LARC? So LARC is a new word. Clap if you have learned something new. Long acting reversible contraception. Okay, long acting, LARC, long acting reversible contraception is the meaning of the word LARC. Okay, yes, very good Rohan, very good Bilal. Okay, very good Sanjay. Okay, long acting reversible contraception, and examples are, I will tell you, triple I, I'll explain to you in a minute. So copper T is best after delivery, spacer device. Okay, when do you use the copper T best? Sir, after one baby. So she has already delivered one baby and now you want to wait for 2, 3, 4 years before second baby. This is called as spacer, to space in between pregnancy. Here your IUCD is very good, because every day taking tablets will be a problem. She can forget the tablets. So एक बार copper T डाल दिया, very good. Okay. Yes, so it is one of the most effective, but I'll tell you most effective, Rohit, I'll exactly tell you what is the answer. Okay, but IUCD, yes, is one of them and it is reversible. So it is in between two babies. It's called, they are also called as spacer devices. Okay, and here it is best long, basically any LARC, any long acting reversible contraception is good for when you want to wait for long acting. Okay, long acting. Now इसमें ना आपको याद रखना है, I'll come back to this topic and tell you the technical definition. Technical definition is when the frequency of administration is more than once a month. मतलब OC pill is not LARC, because OC pill patient has to take every day. Condom is reversible, but condom is not LARC. Condom is not long acting, only one time. Every time you have to use condom. So what comes under LARC? Can anybody tell me? What are, so आप याद रखेंगे 2 eyes, actually 3 eyes है, लेकिन 2 eyes याद रखोगे. One is IUCD and second is implants. I will teach you, very new, nobody else will teach you this. Okay, implants are the new thing. Implants also come under LARC. Okay, and by the way, injectable also comes, because it is 3 monthly injections also come under LARC technically, and therefore remember triple I. Clap if you feel happy. Okay, triple I, IUCD, implants, injection. We are discussing better now what kind of injection. Okay, injection DMPA, we'll discuss that after the lunch break. DMPA. Okay, injection depomedroxy progesterone acetate. Okay, and NET10 bhi aata hai, NET10. All that I'm going to discuss, don't worry. Contraception is a big topic, it takes 2 hours. Okay, yes, very good. So now this covers our all this, and moving on to the next one, OC. So this, remember, yaad rakhenge triple I. Is it clear? So what comes under LARC? So question aayega, all are LARC except IUCD, implant injection, OC pill, or even tubal ligation. So tubal ligation is permanent method, it's not reversible. Okay, long acting reversible contraception. Okay, next is OC pills. Anybody, what is it is called COC, combined oral contraceptive pills. Okay, anybody, what's the mechanism of action? What does OC do? Oral contraceptive. Why combine? Because it contains both estrogen and progesterone. Estrogen, progesterone pills, birth control pills जो बोलते हैं वो. Very good. Regular cycle, very good. Inhibits FSH, very good. So most important, first one, it suppresses ovulation. Okay, suppresses ovulation. Second, makes the uterus unsuitable for implantation. Excellent. And third is also makes the cervical mucus thick. Very good. Okay, so all the three. Okay, inhibits the yes, basically remember suppresses ovulation is the most important. Okay, so mainly it suppresses ovulation. So your combined oral contraceptive pill will suppress ovulation. हमारा गया, ovulation गया, uterus unsuitable for implantation, तो वो भी गया, uterus not suitable, and then the cervical mucus will also become thick. Okay, that is last, but mainly main action is this. Okay, suppresses ovulation, main action. Again, very good method. The failure rate is only around 1%. Okay, women who don't ovulate and don't correct, and around 1% if taken properly, 1.5%, some say 1.8%. That's it. But 1 to 1.5%, point कम भी है, 0.5 to 1.5 you can remember, or 1 to 1.5%. Okay, around 1%. Remember 1% if taken properly. Okay, so now all of you, can anybody tell me what is the meaning of low dose OC pill, standard dose OC pill, very low dose OC pill? So इसमें remember all of anybody, what is the meaning of all this standard dose, low dose, very low dose? ये क्या है? So here we are talking about the dose of estrogen. Estrogen is the same in all the pills, ethinyl estradiol. EE stands for, I'll tell you the full form, ethinyl estradiol. So anybody, what is standard dose OC pill? Low dose, very low dose? But a failure rate. (1 to 1.5%) याद रखो. Some books mention 1 to 1.8%. That's okay. Yeah, it's a failure. Yeah. Yeah. So what is the anybody standard dose, low dose, anybody knows or does not know? Okay, so all of you pay attention. When every tablet, 4 are available, very good. Okay, so when each tablet contains 50 microgram per tablet, that is standard dose. 30 microgram low dose, 20 microgram very low dose, and 10 microgram is the ultra low dose OC pill, the least available. Okay, and this is the dose of ethinyl estradiol. Okay, this is the dose of ethinyl estradiol. Okay, so you can also get match the column. Okay, match the column आ सकता है. एक साइड पे ये सब दे देंगे, standard dose, low dose, very dose, ultra low dose, और ये साइड पे 50, 30, 20, 10. Okay, like that they can give. Yes. Okay, so this is the, so mechanism action हो गया. Now tell me all the most important, all the benefits and uses of OC pills. So what is the mechanism action? You know, suppresses ovulation, makes the uterus unsuitable, failure rate ho gaya. Now tell me all the benefits and uses. Anybody? What will happen to the cycle? How is OC pills taken? Okay, so all of you know, okay, you take it from the day one. It's a packet of 21 tablets. Every day, one tablet patient will take for 21 days. And then 7 days, there is pill free interval. And again, take it for 21 days. During the 7 days, there's withdrawal bleeding. And again, stop for 7 days. And again take for 21 days and stop for 7 days. So the cycle is becoming regular. Very good. Patient को खुद को पता है कि sir, when I will stop the tablets after 4-5 days, there's withdrawal bleeding. So cycles become regular. What else? The blood flow which happens during this 7 days is less in quantity, and even the pain disappears. So it's like Ramban. Ab kisi mein bhi, I can use it for irregular periods also, I can use it for menorrhagia also, I can use it for dysmenorrhea also. Then the newer OC pills will also decrease the acne and hirsutism. Which one specifically I will tell you will decrease acne and hirsutism. Okay, so the advantage is I can give it in PCOS patients. And anybody, when you take OC pills for long time, what are the 3 cancers? Okay, they will also helpful in benign breast disease, functional ovarian cyst, ectopic will become less, PMS will become less, premenstrual symptoms. Okay, premenstrual symptoms are that before the periods, patient gets lot of irritability, water retention, mood swings, all that. Now 3 cancers which OC pill will decrease. Clap if you feel happy. याद रखेंगे mnemonic CEO. CEO stands for colon, endometrium and ovarian. Thokotali. But long-term use, only theoretical, remember. Long-term use, cervical cancer slightly increase, breast cancer marginal, not so much, no panic. You can use it for 4. This is only after 5 to 10 years. After continuous से 5 to 10 years अगर आप OC pills लेते हो तो थोड़ा cervical cancer, breast cancer, mainly hepatic adenoma. Okay, so remember for MCQ purpose, 3 cancers which decrease and 3 which increase. Cervical cancer, breast cancer, hepatic adenoma increase, colon, endometrium, ovarian decrease. Okay. Okay, so all of you please pay attention. 5-star slide, 7-star slide, please by heart it. Okay, so all the menstrual disorders like dysmenorrhea, menorrhagia, irregular periods, I can use OC pill. Cancers, endometrium, ovarian, colon, I told you CEO, benign breast disease, functional ovarian cyst, same logic, because cervical mucus will become thick. Okay, so the cervical mucus will become thick, PID will become lesser, and therefore ectopic will also become lesser. Endometriosma, you can use it continuously, and acne, hirsutism will become lesser, and even PMS will become lesser. Now all of you look on the board and clap afterwards after you feel happy. पहले देखो बोर्ड पे and tell me yes or no. Patient of PCOS has got irregular periods. Yes, sir. Patient has irregular periods. So when she will take the OC pills, cycles will become regular. Very good. PCOS has got acne hirsutism. Yes, sir. So even acne hirsutism will become lesser. Why? Because I'll tell you which OC pills have got anti-androgenic property. And PCOS in the long term can develop which cancer? Endometrial cancer. So all they are made for each other, and that is why clap if you feel happy. मैंने क्या कहा था कल? PCO, उल्टा कर दो OCP, ठोको ताली. All the problem of PCOS beautifully, it's a symptomatic management. That's sir, when you take patient of PCOS, when you give OC pills, cycles will become regular, acne hirsutism will become lesser, future endometrial cancer is also protected, apart from fertility. Okay, so all the problems of PCOS, beautifully controlled by taking OC pills, PCO, OCP, ठोको clap. Except when she wants pregnancy. Yes, when there is pregnancy, then you have to go for ovulation induction, kalka revision. Okay, otherwise all other patients you will manage by giving OC pills, apart from weight loss and your metformin and all that. Okay, clap if you feel happy. Is it clear? So PCO, OCP. Okay, is it clear to all of you? Yes. So all these are the different things. And the last part we should know is that specifically, which are the acne, hirsutism, decreasing occipitals, anybody? So yeah, lunch break is coming in 10 minutes, beta. Lunch break is we are going in 5-7 minutes. Okay, दो नाम याद रखेंगे. That's sir, ciproteron. Ciproteron is a progesterone with a anti-androgenic property. No, but mala mein na, mala is called LNG. So ciproteron is new. They will teach you in dermatology also. Ciproteron acetate and drosperinone. Both this drosperinone is a spironolactone derivative. What is the advantage? These are progesterones. Okay, please understand. Estrogen to ye rahega. Estrogen will be EE, ethinyl estradiol. So when you take a patient a pill which contains ethinyl estradiol and ciproteron or drosperinone, both these progesterones have got what benefit? So these are progesterones with anti-androgenic property. Is it understood to all of you? So when I give a patient, so normal students will only say that PCOS patients give OC pills. My students will say, sir, OC pills with ciproteron. Okay, ciproteron is a progesterone. Is it clear? So can you, so if they ask you what is the property of ciproteron, sir, it is a progesterone with a anti-androgenic property. So very, very important point. Please don't make a mistake. So ciproteron and drosperinone both are progesterones with a anti-androgenic property. Okay. Ciproteron or drosperinone. Both these have got what property? Anti-androgenic, and therefore they will suppress the androgens, and when you have anti-androgen property, they will help the patient in acne and hirsutism, and PCOS symptoms will become better. Okay, so I hope all of you, this is very, very important, and we'll just start this one. Yes, okay, moving on. Yeah, and the last part of OC pills, can anybody, and then we're going to, what are the absolute contraindications for OC pills? What is the meaning of category 4? Now everybody tell me, category 4 का मतलब क्या है? What is the meaning of category 4? Category 4 means what? Absolute contraindication. So what are the absolute contraindication for OC pills? See, OC pills are metabolized in the liver. So acute liver disease, then severe hyper DVT, thrombosis, stroke, and remember complicated migraine with aura. Okay, if they're getting flashes and all that. चार खाली याद रखेंगे. And breast cancer, already if a patient has breast cancer, very good. Pregnancy understood. Heart disease, very good. And breastfeeding, because estrogen decreases quality and quality of milk. So breast का दो याद रखना है, breast cancer also and breastfeeding also. Okay. breast cancer also, and breastfeeding mothers, lactating mothers, you can't give ocipils. Okay, yes, DVT, very good, Rohit, thrombosis, stroke, all that, and severe hypertension, severe diabetes. Okay, so again, a 5-star table. You don't have to remember everything, but all of you look on the board. Category 4 means absolute contraindication, and इसमें याद रखेंगे active liver disease, breastfeeding, thrombophilia, heart disease somebody told, complicated migraine matlab migraine with aura, flashes, okay, heart disease, breast cancer, severe hypertension, severe diabetes, and thrombosis, DVT, stroke. Okay, mild hypertension, mild diabetes, and just few cigarettes in a day. Yes, you tell the patient to stop smoking, but they are relative contraindications. Okay, similarly, age more than 35, but nowadays we give till 45, no problem. Okay. So why they will tell you? Suppose they tell you patient has got, okay, patient has got severe migraine headaches, or patient is having migraine headaches, or she is having liver disease, which is to be avoided, then you will avoid copper T, as you will avoid ocipils. Okay, so you have to choose among all the options and then select the best. Okay, so patient is lactating, so what is to be avoided? Ocipils, because breastfeeding. Okay, so these are all your absolute contraindications. Okay. Okay, is this understood to all of you? So this is our pre-lunch session where we discussed all about the IUI, IVF, ICSI. Then we went on to discuss primary amenorrhea, cryptomenorrhea, and contraceptive topic I have started, and 3 most important barrier methods, ocipils and IUCD are discussed. After the, somebody was asking what are the injections. So after the lunch break, we're going to discuss injectable contraceptions. Then I'm going to discuss you about this implants, which is something new. Then I'm going to discuss about the emergency contraception, and then go on to the MTP topic. Okay, so it's going to be a very, very important session. Don't miss out. And then we will also be discussing the topic of, so ये contraception खत्म हो जाएगा, and menorrhagia topic, which is very important topic. Menorrhagia will be finishing also after the lunch break, and time permitting, I will meta all the 3 ocipils, all the 3 mechanism of action suppresses ovulation. Mainly, main action suppresses ovulation, makes the uterus unsuitable for implantation, and cervical mucus will become thick. Okay, is it clear to all of you? Okay, so thank you very much for coming in. It's a lunch break for around 35 to 40 minutes sharp. Up please, around 155, please come back. And 2 o'clock, 2 to 5 session, so 2 will start slightly before that. 1:55 p.m. we meet. Okay, we meet at 1:55. Okay, thank you all of you, and I'm sure all of you have already subscribed to the YouTube channel and also follow on Instagram. And something more about the app and all that we'll discuss. Yeah, the last 2 p.m. class. Yes. Okay, all of you, just 1 minute please, just 1 minute of your time I will take. All of you are enjoying the class over here, I know that. Please tell all your friends. Okay, because somebody may want only OBGY my app, and all of you also welcome. So please, it's a superb app with all the features. You are getting the lecture over here, but if some of your friends may not be joining for the whole batches and they may want only OBGY from me, so please tell them that this OBGY app is available, and you can share with them these photographs of your this, and they can also please subscribe to the app at a very, very low cost. There is the price available. Okay, so these are the app, and these are the features of the app, and I will see all of you in the post lunch session. So please tell all your colleagues and friends about this app, and they can get in touch with me if they have got any doubts. And of course, if results are there for you to see, and these are also the kind of handwritten notes which are available. Okay, so best of luck all of you, and I will see you in the post lunch session. And if you haven't subscribed to the YouTube channel, please subscribe. And I will see you at, yes, 1:55 sharp. All of you, please come back. Thank you and see you in the post lunch session.